that impact our budget? How does it impact the county's budget? County's budget and Clean Water Services budgets are very, very different in terms of where our sources of income come from, which is why he spoke to the County Budget Committee on May 14th, I believe, and the Clean Water Services Budget Committee on June 5th. Eco Northwest has compiled a tremendous amount of information of models and analysis and pieces like this. We gave the budget committees kind of a high-level picture. We wanted to bring John in today to kind of dive a little deeper into some of the other research they did. So with that, I'm going to go ahead and put you in the capable hands of John Tapania, who will walk you through this.
All right, thank you, Mark, and thank you, commissioners. I did plan on delivering this in person, as I did about a month ago with the budget committee, but late last week discovered that my son had been in contact with someone who tested positive for COVID, and so he's in quarantine at the moment, awaiting his own COVID test. And so I didn't want to be any part of Washington County's contact and tracing if I somehow end up in his network of
Thank you
of
for
infection.
protecting us.
Absolutely, and I think there's a story there. I think we're living with this until we have better therapeutics and/or a vaccine. So this is going to be an ongoing story in that regard. Again, thank you. This has been a privilege to work on this. We've learned an awful lot just by the questions that have been asked. So why don't we move through here? I know many of you have seen earlier versions of this, and I will say this is a rapidly changing environment, and get used to it, because I think this is going to be a lot of changing and sometimes confusing information coming at you over the course of the next 12 to 18 months at least. So today's questions: the May jobs report, do we believe it? If so, how has it changed the outlook? So positive news came out of the Bureau of Labor Statistics on May jobs. We're going to take a little look at that. How might the recession affect the housing market? What are the implications for county residents? The big topic before the pandemic and before this recession was the lack of affordability in housing. And so do we have concerns there as we go forward? And we do. Which parts of the budget are the most volatile during a down cycle? We're going to take a step through some of the bigger parts of your budget and give our best shot, having worked with Jack and Stephen, at a rough estimate of where we think the impact on revenue may be and its magnitude. And then finally, to what extent did the CARES Act mitigate the short-term economic harm? That is by far and away the largest relief package ever issued by the federal government, including the New Deal and the 2008 recovery package, et cetera. So how has it landed, and how is the county being affected, and how does it react to it? So those are questions. We'll move on to the first one. So there's that first question on the May jobs report. Let's go ahead and get into the next slide. So unemployment, it was a big shock in the May jobs report. The consensus among economists is that they were expecting, given what they saw with new claims coming in, is that unemployment was going to rise to 20%. Rather, it came in at 13.3% officially. It went down a little bit between April and May, which caused some people to think, wow, has the BLS succumbed to maybe some tampering inside of the agency? Many economists have sort of come back, those who know that agency well have come back and basically said no, they don't believe there's any tampering of the numbers in the BLS. Had there been, some of their rank of 2,400 very dedicated civil servants would have cried foul to the press, and there hasn't been anything like that. One explanation is one particular code, and again, this is a fast-moving environment. So there's one particular code in there called employed but absent from work that could be masking people who are ultimately going to be unemployed. And so this just shows if here's that official number, unemployment at 15% nationally, tapering down to 13.3. But if you took that classification of employed but absent from work and counted them as unemployed, that unemployment rate would have been up to, at about 20% in April and come down to maybe 16% or so in May. So we will learn more as more of these reports come out. And another area of concern here as you're absorbing and learning from these BLS data is that some of these are based on household surveys, and fewer people are accessible during the pandemic. So there's an awful lot of challenge just with respect to data collection on BLS's part, even if they're trying to do it as cleanly and accurately as possible. The environment is changing for them. So that's that spike up, how high it is, we may not know for some time. Try to understand as these data start to stabilize. The part that is believable, though, as we look at the data, is that factors probably did improve between April and May. There was more economic activity, and so there probably were more people working. And we can see that in the next slide. Even just in Washington County, we've shared slides like this in the past. This is from the think tank at Harvard University, Opportunity Insights. And this is just one of their indicators that shows consumer spending relative to January. And if you sort of follow that line and you look at the March-April period, that was down by well more than 30%, about 35% or so. But you can see it sort of trending up in the May period. And now, as of June 3rd, it was down about a quarter from its January levels. So things were legitimately improving in May. And so we shouldn't be terribly surprised that we would see increased employment in May as well. Next slide. This just came out on June 10th. This is the Federal Reserve's. They do their quarterly economic outlooks. And this is where they see unemployment rates for 2020, 2021, and 2022. The red line is sort of their baseline, sort of midpoint estimate that they have there. So you can see that red line, if you sort of follow it across, get you about 9.8, almost 10% unemployment is their estimate for 2020. But look at that range. Anywhere they're basically telling you if it comes in between 7 and 14%, that's what they're expecting, and you can see it sort of gradually declining over time. This, from my perspective, when they came out with this estimate, it's more optimistic than the presentations I've given you a month ago that were from the Congressional Budget Office. Congressional Budget Office was anticipating unemployment in 2020 to be in the low teens and still in and around 10% in 2021. This looked like sort of more optimistic news to me. And yet, shortly after the Fed came out with this, the markets took a dive, which, again, if anybody in the room understands recent trends in the stock market, let me know, because they're pretty wild right now. But in any event, this is Chairman Powell and their team's best estimate of where unemployment is headed. Their best crystal ball as of 6 days ago. Next slide, please. And so I will just say over and over and over again, as you've seen, case counts are on the rise in Oregon. The governor tapped the brakes on reopening, as you are all aware. I still live in Multnomah County and am not out of the original phase, but we're going to be watching this closely over the until we have a vaccine. And very much like me right now, I'm 1 degree of separation from a coronavirus case, and that's why I'm here and not with you. Had I been with you, I don't know if the Starbucks nearby your chambers was open, but I probably would have swung in and bought a cup of coffee. I might even bought a snack or something. But I'm not. I'm here, so I'm not spending that money in Hillsborough. I'm getting something out of my refrigerator instead. So that is just an illustration that as these cases continue, and we are fighting this, that has economic activity, impacts on economic activity. A little bit, I've had the benefit of being on a phone call this morning with OHSU's top data scientist, Peter Graven, and his best crystal ball with respect to the pandemic is that you would probably see fits and starts over the course of this summer. The fact that that heat probably does help to some degree in terms of virus transmission, dampening its ability to sort of live between people. And then also that people are outside more and not congregated in indoor spaces quite as much as they usually are, that you might see just sort of a steady sort of plodding along with no big spikes this summer. But he is worried. He is worried about the fall. And they and every other sort of healthcare system and public health system has their eyes on this virus come September and October, November. So that's, as I have said before, if you want to know where the economy is headed, keep an eye on the public health situation. Next slide. How might the recession affect the housing market? What are the implications for the county and its residents? So we're going to step through some affordable housing or housing affordability discussion here. Let's go ahead and go to this next slide. Here's the beginnings of concerns. These are your permit activity, year-over-year quarterly change in residential permits. You can see those fell during the last recession, and they were beginning to fall. If you go all the way to the right-hand side in Q1 of 2020, they were already beginning to fall before this pandemic got started. When those permits come down, they have long-ranging impacts. They're the sort of the beginning of the pipeline of housing, and so keep an eye on that. We will make an argument at Echo Northwest that if your population continues to rise and you are not constructing units in concert with the growth of household creation, you're going to put upward pressure on prices, and these declining permits are concerning to us. We'll just keep pounding on this point as we step through this whole section. Are different versions of this same point. So let's go to the next slide. Here's what happened in the aftermath of the last recession. This is just the estimated change in housing units coming out of the census from 2005 to 2018. You can see sort of the lagged effect, by what percent each year are the number of housing units in the county changing. So they were starting to decline going into that recession, and then really hit their pivot point down there in 2012, where there was very little change at all, and then gradually grew out. So there's this sort of, at least there was in last recession, sort of this lagging effect. The bubble burst, or was beginning to burst, probably 2006, 2007. The permits went down, the construction went down, but then those effects of what's coming online in terms of units doesn't really fully get absorbed until 2012, and then you start to slowly grow back out of it. That was a key to the affordability challenge that you have, and that basically you share with communities up and down the West Coast of the United States. Next slide. And here's the point on what happened in the greater Portland area. This is work that we did for the Portland Business Alliance. This is now not Washington County alone, but the entire region built 8.5 units of housing for every 10 new households formed during 2010 to 2018. That compares to a longer run average from 1960 to 2018 in the US, where 11 units of housing were being built for every 10 households formed. It's helpful to have sort of construction outpace household creation a little bit, because you're going to have some housing come offline as it gets old and is torn down, et cetera. And some people having more than one house, vacation homes and the like. But that 8.5 to 10 building rate, as you can see in sort of the title of the slide here, meant that over that period of time, we underbuilt by 23,500 units during that time period. That, we would say, was a major driver of the upward pressure on house prices and on rents in the region. Next slide. And to my point, underproduction drove rents higher. The dark black line is affordability at 100% of median family income. So that's the rent that can be afforded by a household that's at the median. The lighter black dotted line at the bottom is rents that are affordable if a household has 60% of the median family income. And then the orange and blue lines, respectively, are Multnomah and Washington County median rents. So in essence, what this is showing you is that for between 2000 and 2012, the median rent was affordable at the 60% of median family income. But as you think back to that other chart that I showed you, that underproduction, sort of from 2008 to 2012, helped put upward pressure on rents. You can see those rents start to take off and blow past that 60% threshold and get higher and higher. So just creating some deep unaffordability for a good share of your residents. Next slide. So now this sort of gets into what are we up to now? Builder confidence is sagging. This is National Housing Market Index. So again, if I'm worried, here we are at the beginning. Do we repeat history and allow underproduction to sort of push through this recession and have permits fall and then construction, et cetera, fall for a number of years? Here's a warning light. Builders are worried about their prospects instantaneously here as this pandemic got started. Next slide. Construction firms have already seen delays. This is national, but many of these obviously related to social distancing and supply chain effects. So just on the left-hand side, you can see more than, these are various surveys that took place between March and May of this year. On the left-hand side, more than half of those respondents saying they saw delays. You can see permitting delays, 85% saying permitting delays in May, 78% saying delay in starts. You've got, construction moratorium, shortage of labor, et cetera. The permitting delays in particular, that is a place where the public sector has an important role to play. Those are systems that they're complicated to operate during a pandemic and during various phases of reopening. But if that process is slowing down, it all has sort of longer reaching implications as the housing market continues forward, contributing to this potential underproduction, and again, when the economy heats up again, contributing to upward pressure on prices and on rents. Next slide. So takeaways. Fewer permits now means lower production in 2021 and 2022. Pause on construction permits. We see tightening financing and lending standards. And then, developers are going to, and builders are going to have economic uncertainty. They're going to be worried about rent revenues. And so that will cloud their forecast and slow that private side of the market down some. Next slide. Who's at risk? Who's being tipped into housing insecurity? The most vulnerable are those with less than 80% of median family income. You already saw how those challenges played out at the 60% of median family income. It will edge up. Cost burden renters, so all of those who are already out there now renting, spending more than 30% of their income on housing and utilities, and all of those who are working in a sector that is directly tied into the COVID-19. So the epicenter of that is the leisure and hospitality sector, and we've already got any number of people who were struggling with rent before the pandemic started. The downturn in the economy is just going to tip folks over. As a note, and I'll make this point a couple of times, I did check in with the 211 information hotline, the non-emergency sort of services hotline. And they said that their call volume has gone up 2.5-fold since the pandemic started. Their web traffic went up 44-fold over the course of this pandemic. They did open up and administer a housing stabilization fund on behalf of the city of Portland. They opened that on April 27th at 10 a.m. It was oversubscribed at 10:18 a.m. on the same day. So clearly, despite, and we'll talk about, despite the aid coming from the federal government, both the timing and the coverage is imperfect. And just looking at those indicators, you've got some folks out there who are struggling, especially with rent. Next slide. More low-income renters are cost burdened. So they just give you a flavor for where the pain is hitting. If you look on the left-hand side, if you look at households that are at or below 50% of area median income in Washington County, almost all of them are cost burdened, ranging between 80% to 94%. So, that level of income and below is almost the same definition as cost burdening. If you move up to those between 50 and 80% of area median income, you can see that cost burdening ease some, but you're still in a world where half to 2/3 of those households are cost burden. This is just to give you a flavor of the challenge. Next slide. People of color and rural renters are more likely to be cost burdened. So this is all Washington County data, circa 2018. We've got the urbanized areas of Washington County on the bars on the left-hand side, the rural portions of Washington County on the right-hand side. But you can see on both of these, you've got the people of color and at least in the urban area, those with a high school degree and less, probably unsurprisingly, struggling with cost burdening more than others, and higher rates of cost burden in rural Washington County than in urban Washington County. Next slide. To give you a sense, and I think I've shown this slide before, of where the unemployment claims are coming. This just shows sort of major occupations that these claims are coming out of. the groups of occupations at the top of the chart are lower paying occupations. The groups of occupations at the bottom of the chart are higher occupations. And the claims expressed as a share of total employment in those occupations. So the unemployment is much higher in those lower paying occupations. We covered this territory before. Obviously, the one at the very top of the list there is food preparation and serving. That's right at the epicenter of the challenges of social distancing. But you also see an awful lot there in the healthcare support. That hopefully is going down now with reopening. A lot of those support activities around routine medical procedures and or elective care that was prohibited under the shutdown, but now is gradually reopening. So disproportionate pain at the lower end of the wage scale. And next slide, please. And then again, demographically, people of color overrepresented in low wage occupations and experiencing disproportionate shares of the layoffs. So I'll just focus on a couple here. If you look at people of color as a share, this is in Washington County, as a share of all occupations, people of color represent 24% of employees. If you go down to the food services, which is right below that, they represent 36% of employees in the food services. You go down to healthcare support, which was another one, 33%. I don't want to skip over, obviously a big one there, farming, fishing, and forestry, 84% in that occupation. But disproportionate impacts on communities of color, that is sort of consistent with what we're seeing nationally, and certainly playing out in Washington County as well. Next slide. And then housing insecurity can lead to homelessness. This is just a chart, a trend of your chronic and unsheltered homelessness, total homelessness, chronic homelessness, and unsheltered homelessness over time. In our work for the Oregon Community Foundation, we have made distinctions between the challenges of chronic homelessness, which are individuals who have been homeless for more than a year or multiple times over the course of a number of years, versus episodic homelessness, which is probably tied much more to the economy and sort of surprises in people's individual circumstances that takes them a little bit of time to resolve. We would anticipate that you will see a spike in that episodic homelessness, where people just simply weren't prepared for a job loss or other pandemic-related shock to their finances, and may be homeless for a number of months, hopefully not pulled into a chronic situation. But you should expect over the course of the next several months to see increasing rates of homelessness associated with this economic downturn. See what we have on the next slide. And that's my point. If you think of it this way, we could look. We've got big jump in unemployment, is all that chart is showing there. But the key point is we've got tens of thousands of households in this region that are not only cost burdened, but they are severely cost burdened. And that means that they're not just spending 30% of their income on rent and utilities, but they're spending half or more, and they're severely cost burdened. Any little disturbance, adverse disturbance to their situation, and they get tipped into homeless status. And clearly, with rates of unemployment higher than at any time in this country's history since the Great Depression, once this federal stimulus wears off, we should anticipate we're gonna struggle in that category. So that, I think, we'll go to the next slide, is the housing discussion. So I will I'm going to take a breath there and pause. There haven't been questions up to this point. Happy to take any along the way. If not,
Commissioners,
I
do you
will.
have any questions?
Yeah, I
Commissioner
do.
Willie?
Hi, John. Thank you very much. This is, I think this is my fourth rendition, and so it's an ongoing thing. I'll be seeing you next week, evidently. I don't know. You know, weekly update. Two things of your slide presentation here. Back on just a comment on the underbuilt housing that your slide demonstrated, 23,500 units short. I guess I want to make sure we differentiate from that shortfall, that statistic, from the pandemic, because I don't think they are connected. I think as a region, our metro government has driven, and as a state, very, very difficult land use laws, and certainly as a region with the urban growth boundary and the shrinking of that, and the growth that we've experienced as a county and certainly as a region has driven all of this. The pandemic, to me, just exposed it because maybe they were barely hanging on to being able to pay their rent, and then all of a sudden they don't have a job anymore. There's no income to the household, and so that just exacerbated the problem that we have been, I guess, dealing with, or I don't know, ignoring or trying to get around with the shortfall of the housing construction. So that's just a comment. I don't know if you have a comment back to that, but.
I do, and that's a good point. Think of it this way, or a couple different ways. First of all, we had a crisis coming into this pandemic that was related to market and public policy decisions, market dynamics and public policy decisions around land use and any number of other public policy decisions that slow the pace of housing construction. And so we went into this pandemic / recession in a challenging spot with respect to housing affordability. And what we want to underscore is that you are now in a position much like you were in 2007 to 2009, where you could make it even worse because of the economic conditions. You know, you've got developers that are worried about rents going forward. You've got permitting delays. You've got any number of factors that created the problem that we had in the last recession, and we're at risk of repeating that again with respect to underproduction, which, fast forward 10 years from now, we'll be back here talking about how, we lived through 2 recessions and underbuilt in both of them, and put, significant upward pressure on prices.
Well, and I think, and I think just next conversation to me with our regional government would be, we've got to find a happy spot in here. We cannot maintain the restrictiveness of land development and land availability and not expect us to have this exact same result. But that's just my spiel, and it's nothing to do with pandemic. But anyway, just that was my comment. The other thing that's interesting to me is your slide 11, you showed that, or slide 14 was the permit activity. And I want to make sure that I'm understanding that slide correctly, because I've kind of had this conversation with our LUT folks and with some city folks around, and said, are we seeing a slowdown in our ability, the government's ability to provide permitting in a timely fashion? And the answer was given back to me was no, we're on track. But this would kind of disagree with that, wouldn't it?
Well, and my apologies there. That was a national survey that you were looking at,
okay,
with respect to permitting, and so that is a national story. We should dig in and look at the local story and get a sense. But I had a couple of slides in there in terms of the builders' confidence and that construction survey nationally, it would suggest that nationally, this is a story of concern. Builders are lacking confidence, construction slowing down.
Okay.
I would be concerned about your permit activity. Your permit activity is down. That is in Washington County, and that is a leading indicator that your unit creation is going to go down in the future.
Okay. Yeah. So we could have that. We could have more discussion on that kind of internally. So,
Right. So, we did have those slides on. Your permit activity was down in the first quarter of 2020 before the pandemic really got going. And the question around that is how much of that was just sort of organic market related versus, ultimately government's ability to respond and approve permits.
Yeah. Okay.
Both of those need to be paid attention to.
Thank you.
All right. If there are no questions on those earlier parts, I'm going to step through this next piece, which is a sort of our attempt to give you some feel of where we think your overall budget is headed. And many of us are familiar with the state's forecast. The state is unusually tied to highly volatile forms of revenue, be it the income tax, which has capital gains in it, and corporate income taxes, and the like. And their revenues are projected to go down by somewhere in the neighborhood of 20 to 25%. Fortunately, your portfolio is different than the state's portfolio. And we have talked about this in the past in a little bit less detail. The property tax system for, property tax limitations going back to the 1990s, it is from an analyst's perspective, it has its flaws. Instability doesn't happen to be one of them. You can argue it doesn't, it's inadequate. You could argue it is inequitable, but it is a relatively stable tax in the way that it's been designed in the differential treatment and application of real market value and assessed value. But that's your big player and that's your big box here. So this is what you're looking at. This is sort of the big $500 to $600 million budget that you're dealing with. And what we have on this chart is this is not forward looking, but essentially what we've done here is go back to the last recession, and we've got all your major forms of revenue in here. And we said during that recession, from their peak levels to their trough levels during that recession, how did they fare? And you can see that, if I just sort of look at this tree map, it looks like about half of that portfolio actually grew during the recession, with property taxes sort of leading the way. And then half of it in various groups declined by various degrees. And again, this was from peak to trough for each of those different kinds of revenue. That doesn't mean they all fell at the same time or rose at the same time, but this just shows how bad it gets. So in that sort of lighter color of rose, those various bits down there, the all other, the other state grants, et cetera, those at their worst fell 5%. The next shading, which included the SIP revenue and state motor vehicle appropriations and public health, et cetera, that fell from somewhere between 5 to 10%. You had more concern down in the that sort of darker red, the community corrections, transient lodging taxes, HUD block grants, et cetera, 10 to 25%, and then you had 25% or more over in the grant. Those are idiosyncratic grant carry forwards, et cetera. You had other federal grants, ODOT revenue, and real property tax, transfer tax, et cetera. If you sort of took all of this together and said, let's take and applied it to your current budget at this current point in time, and applied sort of all the increases and the various decreases, et cetera, and experience the same kind of ups and downs as you had in the last recession, you would anticipate your budget to fall by about 3%, according to our calculations. But this is a different recession, and so we're going through a number of these lines. You've got, hundreds. We weren't able to go through hundreds of them, but we did go through some of the bigger ones to give you a sense of where we think some of your bigger or smaller exposure is. So let's step through that. Next slide. This is property taxes, and sorry, we didn't. The S didn't show up on the end of tax there. But all of these charts that I show you, these are representations of history and your current budget. So these aren't our projections in that gray area, but rather what we pulled out of your budget as projections. And the commentary that you see on the slide is what we're anticipating you could face relative to that 2021 budget amount that you have there. So in this case, looking at history, we would say that the collections might decline relative to budget by 1 to 2%, or $2 to $4 million, with most of that being lost sort of at the margins as new housing, new units aren't coming online. Sort of your overall base, which is tied to that assessed value, will continue to grow. There's a huge difference between real market value and assessed value. And so, except in very rare circumstances here, you're going to anticipate that to slow. So property tax is relatively stable, probably a $2 to $4 million reduction relative to what you're looking at in budget. Next slide. Here you have your transportation development taxes, your SDCs, and land use planning charges, et cetera. Again, the line here is showing you history and your actual budget. This is an area, percentage-wise, where you have a lot more cyclicality going on. So here we would anticipate, having looked at history, that your collections could fall by 30 to 40%. Which could hit your budget $3.5 to $4.5 million in the upcoming fiscal year. So that's much more cyclical, obviously related to development, and much more responsive to recessions. Next slide. Video, liquor, and marijuana. Relatively recession and pandemic proof, although the video lottery you've got this is not pandemic proof. Lines in your budget that are going up, we would anticipate that video lottery is the one that's going to take a haircut. This collection may come down roughly around $1 million in whole. The liquor, and again, you have good guidance sort of looking in partnership with the state, because they too have to monitor all three of these closely. The liquor taxes are a story of household purchases offsetting business purchases to some degree, but that's mitigated by increased consumption at home. Marijuana tax is probably bumping up some, and the video lottery is really the one at risk here, and is only going to respond if we can get further into reopening and social comfort with being in closed rooms with other people. Next slide. Transient lodging tax and restaurant license fees. Here, again, there's your budget. We would say anticipated decline in revenue of $2 to $3 million relative to budget for these two. The restaurant license fee is going to take a hit if restaurants go out of business altogether, and there will be some of that clearly, and it's already happening, and you can see it. The transient lodging tax obviously is suffering and will continue to suffer. This is one where you'll just have to keep a close eye on real-time data in terms of how people are starting to feel more comfortable getting out, traveling, and staying in hotels. Next slide. Just a few other items that are worth calling out. The Metro Homeless Services. This is, both you and the state have two big new revenue sources that are coming online that were created either during the pandemic or just before the pandemic, or were being raised just before the pandemic, which makes things a little bit confusing, but also mitigates to some extent the challenge of providing public services. In the state's case, that's a commercial activity tax that was passed to fund schools and early childhood education. That came online. Businesses started paying that tax at the beginning of January. It will begin to be distributed to school districts and others on July 1st. None of that money existed before the pandemic. And so it is smaller than we had hoped for, but it is obviously more than had existed before. And so that is puts upward ability on the ability to provide services. Same thing for the Metro Homeless Initiative. There was an anticipation. This was roughly $250 million for the Tri-County region under normal economic conditions. Obviously, we're not in normal economic conditions, so there's going to be less money than was anticipated at the time that the bond was being created. But nonetheless, there's going to be a fair amount of money flowing through that. And we're estimating when it comes out of the gate, it'll hit at about $60 million on an annual basis. The SIP is obviously a big one, and there, you need to be in the room with the futurists and the C-suite of Intel to be able to forecast that and really know where it is headed. Keep an eye on the cranes. When the cranes are up, investment strong, and the SIP is flowing at a higher rate. And when they slow down sort of their investment cycles, the SIP slows down as well. We saw that over the course of the last decade as well. And then the vehicle registration fee, which is a new one, that one will probably decline a few percent relative to budget. Again, folks are in a recession. The size of this one probably scaling back on big purchases like cars, and so we anticipate that to slow down for relative to pre-pandemic expectations. Go to the next slide. Just again, you've got this is a big category of permits and licenses, but as big as this chart looks, I think we've got something like it's less than $10 million, I think, relatively small part of your budget, and one that we didn't go through and have the ability to model all these various pieces, but areas that you might want to take a look at. Next slide. This, why don't we go ahead and go? We'll go to the next slide, which sort of puts these two pieces together. that everything else category, which is the blue, and then you've got these other permits and fees. This gives you sort of a higher level view of how that whole package, which is a sizable package in combination, performed over the course of the last 13 years or so. You see some dip in the 2007 to 2013 period, but not sort of an overall collapse. And so we would not expect a huge decline there. I think on the next slide we sort of have our roundup here, which is if we take your budget as a whole and we move through and look at all these various categories and how they performed, and we think about what's going on in this recession as opposed to the dynamics of the last recession, all rolled up, we would say our best guess is an anticipated decline relative to the proposed budget of somewhere in the neighborhood of 5 to 6%, with good room both on the downside and on the upside for that number to move. On the downside, clearly, if this doesn't become what some have characterized as a quote unquote square root economy, where you have sort of a nice bounce back for some number of sectors, including healthcare and parts of retail, et cetera, and long ongoing struggles for leisure and hospitality, that would be your square root recovery. If the square root recovery happens, that's sort of what's embedded in this. You're probably in this 5 to 6% range. If, on the other hand, the pandemic comes back with a vengeance in the fall, and we have to go back to something close to a lockdown again, and we end up with a recovery that some characterize looking more like a W, with another big, deep downturn, obviously you've got a whole lot more downside risk with respect to your budget relative to these numbers. On the other hand, look at those May job numbers and look at the retail sales reports that came out this morning, which boosted the market's mood. That feels a little bit more like a V, and maybe getting back into single-digit unemployment rates in this calendar year, in which case your declines wouldn't be as severe. So an awful lot of sort of uncertainty left. I think this last slide, we just sort of step through with a summary item by item of the major items. And again, I can't characterize that we have gone through all of the hundreds of couple hundred lines one by one and tried to tie them to the economy, but these were the big ones. You do have a sizable other category there that we took down by 16 million, but then you've got your land use taxes and your SDCs and your property taxes, the transient lodging taxes, et cetera. All of that sort of summed up to almost a 29 million, 5.5 to 6% decline in the proposed in revenue relative to the budget levels, which is certainly isn't trivial, but is not the scale of challenge that is being faced by the state at the moment. So I'll pause there and certainly say I know my colleague Andrew Dyke did the sort of the original detailed research on this. If there are really in-depth questions, I would sort of ask to call a friend or have a friend come back in front of you in the future. But he has been working closely with Jack and Stephen, and I think they're again, they don't need to endorse this, but I think they have been in close contact and relatively feeling sort of on the same page on these numbers. But we own them.
Commissioners, any questions? Commissioner Willie.
Yeah, going back to slide 29 there, where you had selected revenue streams, you were talking about the Metro Homeless Service projection, are you saying instead of, because the 250 million was their targeted amount pre-COVID, okay?
That's right.
Are you saying in this one that you're anticipating it's only going to be 60 million?
Your share of it.
Oh,
So that
okay.
your share of it.
Yeah,
Yeah.
sorry. I was going
Yeah.
to say, wow, that's quite a
Yeah.
haircut there. So
Yeah. No, I think you may have been in the neighborhood. You may have been in the neighborhood of 90. I'd have to go back and double check that.
yeah, I can't remember what our number was either, but yeah, okay.
Yeah.
Still
But
pretty.
a sizable reduction, because in that case you're talking about taxes on high income earners and on businesses, and those are both in the highly volatile category.
Welcome, Commissioner Rogers. Do you have any questions?
Thank you. I got in about a half hour ago, and I might have missed it because I was on travel. On the CWS side, I didn't see what you're anticipating there. Is that coming up, or did you already cover it?
The CWS side, we presented those at the last budget meeting.
I remember I told you I thought that those numbers were off in regard to unemployment, which they proved to be, but I remember that. But
yes. No, we started on that commentary on the unemployment.
Right.
And think, the big push is a lot of speculation about whether BLS had put their finger on the scale. And, to the best of our ability, I think most people are still trusting the civil service to have done their job, but also understanding that these data are coming at them in confusing and fast ways, and that it's going to take a little time for us to sort of step back and actually try to get a good sense of what reality.
Well, my question is this. By the way, it was all over national news that 2 days later they'd miscounted over 5 million. So,
we have a chart for that.
Yeah. Oh, yeah. Because this is a telecast and people are watching, they may not have attended the budget committee meeting last Friday in regard to CWS. Is there some general comments that you want to make so that the viewing audience who may not have appeared there would know what we should anticipate on the CWS side? I mean, a couple of sentences.
Yeah. Well, I would say, like the county, not as much volatility as you would expect. I mean, we're certainly hearing about these massive shortfalls that states are facing, and Oregon in particular, with its high reliance on the income tax and on corporate income and the like, and more stability on the water side and water and sewer usage. Particular concerns around small businesses and the leisure and hospitality sector, and that is the disproportionate sort of impact on revenue, as some of those users may come offline and go out of business. All right.
Commissioner Rogers, Mark Jockers here too. I wanted to follow up on what John said, and what he talked about during our budget committee, and as you may recall this, is our places that we see this potentially impacting us is both on system development charges, SDCs, which John spoke a bit about in terms of the impact of this recession on housing starts here. The other issue that is of concern or potential concern for us is delinquencies on accounts, also related to what John said, is in terms of both businesses, but also delinquencies on residential accounts. He gave us a frame for that potentially on our June 5th budget that looked at something like about a 9% reduction on both SDCs and on our rate revenue. Our budget, as you may recall, has built some of that into it in terms of how we're going to be looking at our budget on a quarterly basis, both with revenues and then with investments we'll be making.
Thank you for the assistance there, Mark. I was trying to keep all these numbers in my head, and those had been squeezed into a part of my brain that I was having a hard time accessing.
Good.
Commissioner Scouten?
Yeah, a couple of things. We were talking about those unemployment numbers that were set to, that the improvement was not as dramatic as we first thought Friday. And I note that you had something about misclassification. Could you talk a little bit about how does that explain that instead of it being 13.5, I think was the number, it should be more like 15 or something?
Right. Yeah. So the big question is there were a sizable number of people who were in a category called absent from work for other reasons, and they were all counted as employed in the rate that came out at 13.3%, the official rate. And so the big question is, should they have been classified as unemployed at that point in time, in which case the official rate would have been closer to 16%.
These people who were not working, but they were getting some kind of a compensation, whether that was through the CARES package of legislation or.
Yeah, in terms of exactly what kind of assistance they were getting, that I don't know. But they were not, they had not officially filed a claim for unemployment, but yet they were absent from work for some, maybe temporary period of time.
Right.
And I think that this just falls in this category of so many things in this space right now are unfamiliar to us and the BLS that we have to give them an opportunity to sort of catch their breath and sort of figure out what they're looking at.
Yeah. And then on the in terms of estimated declines relative to our budget and millions of dollars on the screen, you've got, I guess you got some of the bigger, you got the bigger items. What's the other? Is that just a whole pile of miscellaneous pieces then?
That is a whole pile of miscellaneous pieces where together we sort of went back and looked at your performance during the last recession and then said, if this big pile behaves in this recession like it behaved in the last recession, you could expect something of this magnitude.
Okay, so that's obviously a very big number. I guess it's like one of those things that, I'm just spending a few dollars extra for some coffee and a few extra dollars for entertainment, but next thing you know, you start adding up your additional expenses. It's actually, it kind of catches you unawares, and that's a large number. That's 16 million.
16 million. That's right. It is. It is a large number. Again, and then put it into the context. If you are fortunate enough to have sort of, 5 to 6% reduction relative to budget, your job is hard, and these are services and these are real people on the other side of this. So I don't want to undersell it by any extent. But you are not in the budget balancing challenge and exercise that the state legislature is involved in at the moment.
Commissioner Willie, did you have any questions? No. Commissioner Treese? Mr. Rhodes, I was wondering, to Commissioner Scouten's question and point on the unemployment adjustment and this category of employed but absent, could you please describe to us conditions for Washington County employees who during the Stay Home, Save Lives order, I recall through the temporary personnel rules that there were people who couldn't report to work because they had to take care of their kids because their kids were no longer in school. Might that be an example of how folks were still unemployed because we haven't removed them from Washington County employment, but their status relative to their job was different?
Yes, we had a number of employees in that category because we put together a rather generous program because we knew it was to our advantage at that point. So I'm sure we would have people that would have said absent but employed. A great large number because we tried to empty out our buildings and some people were not able to telecommute. And so they had that category and used that.
Mr. Tapano, would you concur that those folks might be an example of the employed but absent?
I think that sounds right. Yep. And if they didn't formally, file for unemployment insurance during that period of time, understandable, they'd be in that sort of limbo.
Okay. Any other questions? That's it from us.
Okay, I've got one section
Great.
more, which is this CARES Act, which you actually are the beneficiary of through the Coronavirus Relief Fund. So we're going to talk a little bit about how big this was, how it has landed in the county to the best of our ability, and then think about your resources and your initial thinking on deploying them. So we'll go to the next slide. This was by far and away the largest relief effort in the history of the United States. This chart was the best that I've come across in terms of how the big package, the CARES Act 2.3, broke down. You can see in the households, the stimulus checks and supplemental unemployment insurance. If we just go to the right there to the other, you've got that aid to state and local government, $135 billion. That includes money that was sent to you, direct aid to public health. If we keep going over to the right, we've got small business assistance, the discussed Paycheck Protection Program built into those SBA loans, and then sort of all kinds of other business assistance in that red section, delay of payroll taxes and net operating loss modifications, et cetera. And then industry-specific bailouts of airlines and cruise ships and the like, cargo operators. That all summed up to $2.3 billion. Of course, the federal government came back in a second round and increased the Paycheck Protection Program since that ran out very quickly. Next slide. Here are sort of the distribution nationally of how this money flowed out week by week for three of those major programs. The orange is the stimulus, those $1,200 checks. The blue is the unemployment insurance, and that is the $600 per week supplement from the federal government that is set to expire at the end of July. And then the PPP would be the distribution of the Paycheck Protection loans to small businesses. You can see how that sort of flowed. And then the next slide just sort of shows you in a cumulative sense of how this aid has built up over time, so that UI sort of gradually stepping up as people finally got onto unemployment insurance and started receiving that. The stimulus came out pretty hot and got to its total size relatively quickly. And the PPP in two rounds sort of gradually built up over time, but you can see by the end of May, these three programs alone pushed almost $900 billion into the U.S. economy, which is pretty breathtaking. Next slide. And here are how the recovery rebates landed in Washington County, $450 million of one-time CARES Act rebates, 87% of the households eligible. And the average household got $2,300 because you typically have more than one actor in them. If you look across the bottom, those are bins of household income. If you look at sort of the vertical scale, that is the amount of that $450 million that's landing on that category of household income. And so you can see it's skewed toward the middle class, peaking there at, a sizable amount of this assistance in the, $40 to maybe $80,000 range, and then gradually sort of falling off once you get up to about $200,000. Folks were ineligible. So it was a progressive stimulus that was, focused squarely at lower and lower middle income up into upper middle income households. Next slide. Another big feature here, I'm going to have a couple of slides out of order here, but this slide shows the unemployment insurance benefits that are, again, running now through the end of July, and a lot of congressional discussion about whether or not these will be extended. The yellow aspect of this bar shows you the amount of Oregon state unemployment insurance that one would receive if they had annual income codified at the number on the left-hand side. So if we look at for example, somebody who had annual income of $40,000, they would be getting state unemployment of $499 a week. That would represent 65% of their income. But the federal government has come along and said, okay, if you're fully unemployed, we're going to give you an extra $600 a week. And that, taken together with the state unemployment, would get you to 143% of what you were making on an annual income of $40,000. So again, a very progressively skewed stimulus shot. You can see what it does even at those lower levels, 5 or 2 times as much. And then, even at the higher levels, getting folks up to 40-50% replacement, where conventional unemployment delivers much less than that. So that is a big piece, and what happens what happens with the economy and what happens with this program when it expires in July 31st is a matter of an awful lot of debate on Capitol Hill at the moment. I've got a couple slides after this that are a little bit out of order. Go back to the recovery rebates, if my memory serves. The next slide. This just shows you eligibility for those recovery rebates by race and ethnicity. Again, that overall 87% average in this is Washington County, and varying degrees of eligibility across races. 87% sort of the average for white households, 94% for black households, 95% for Hispanic, Latino households, etc. Next slide. The original look at where these CARES rebates were going suggested that right out of the gate they weren't being spent disproportionately on housing yet. Where this was just a survey that was conducted at the end of April for households headed by different race, ethnicity, etc., who was using it for what. You can see about a quarter of Hispanic households saying they were using it for rent, but lower levels there for whites and for black households, etc. There was a fair amount of paying off debts, as you can see. And then we did see in April and in May that savings rates went up significantly during this period. So there was just an awful lot of this money that wasn't spent at all. That was a big concern among those who designed this. Typically when you push out $1,200 checks and send them to people, the aspiration at that time is that they go out and spend it and use it and keep the economy going. What was different this time around is that there was a pandemic going on and we had social distancing measures. So people, they couldn't spend it on a concert. They couldn't spend it on a nice meal in a restaurant. They couldn't spend it on an Airbnb getaway, etc. So, a fair amount of this money was saved, and probably prudently for some of these households, thinking that who knows what these conditions are going forward. I might need it in the summer, in the fall, just to survive. So, next slide. Here's a look at small business jobs. These are small business payrolls, number of hourly employees in small businesses down almost 40% in Washington County from the January levels. Again, not surprisingly, a lot of these are going to be in the leisure and hospitality sector. So despite that big program, that Paycheck Protection Program, still an awful lot of shedding of small business labor in Washington County and across the country. You see the little note on the bottom left-hand side. As of May 30th, SBA approved 57,304 loans, PPP loans in Oregon, totaling $6.8 billion. Now, those loans are originally sort of purposed as a loan, but if the business maintains its labor force over a prescribed period of time, and I think the rules are changing sort of in real time. Echo Northwest is a recipient of one of these PPP loans, but if the company manages to maintain its employment or some good share of it, a sizable share of that loan can convert, in essence, to a grant. It ends up for some business being a sort of a liquidity injection into the company in grant form that sort of allows them to sort of continue on. If they didn't already use it for payroll, it helps them weather tough times that might come ahead. Sizable program, but needless to say, didn't completely stabilize small business employment by any stretch. And not surprisingly, many small businesses that looked at that loan and said, we don't have a prospect going forward. We don't see a bridge to the future, didn't take the loan because they didn't anticipate being able to hold on to those employees in the long term. And so sent those employees off into unemployment insurance, where they had much better options and that $600 a week federal supplement. Next slide. So that brings us to your resources. This is just a memo that Stephen shared on a coronavirus relief fund work group, and sort of its initial thinking on categories of spending under the coronavirus relief fund. So that is sort of broad-based support to state and local governments out of this CARES Act to help you in a variety of different ways. One thing you cannot do with it is replace revenue and say, oh, our revenue went down, so we're just going to count it as revenue and sort of aid our budget. But there are an awful lot of things you can do with it, and you've already put some good thought into that. Basically any public health expenditure or any public safety expenditure over this period of time of the shutdown can be easily characterized as related to the coronavirus. I think according to their guidance, the U.S. Treasury's guidance, they are not going to come back with any kind of hard audit on replacement of expenditures or reimbursement for expenditures out of public health or public safety over some period of time. And so those are easily reimbursed. Obviously, a lot, all the spending on contact tracing and PPE and other kinds of outreach campaigns that you might have in your efforts to fight the virus are clearly usable under this. That's the public health, no big surprise there, and that's where the work groups, sort of the bulk of the idea of the money goes. This second category of economic support, broad ability for localities to create little miniature programs of stimulus checks or paycheck protection or grants to small businesses, in the same way that the federal government created a very big one, and a fair amount of flexibility about how to go about that. This next category that you folks created, aid to community-based organizations and nonprofits. Again, sort of similar. Most of those are nonprofit small businesses, and many of them struggling. You have a piece here on community psyche / mental health. There is, again, a call that I had this morning that I participated on with OHSU's Peter Graven. He was saying, essentially, we are in lockdown fatigue. Folks have gone through behaviors that are just unnatural to them. We are humans, we are social beings, and we have been told to be antisocial for an extended period of time, and we are just dying to get out and interact with one another. And so, I think your work group had some ideas on campaigns and et cetera, and supports to help people through that fatigue, and to the extent that we become more successful in helping people overcome that fatigue and keep their head in the game of beating this virus and staying healthy, the better will be the public health situation, the better will be the economic situation. So that brings me to just some broad considerations as you can continue to spend and frame out the rest of this spending, and who knows, maybe more is on the way. Number one, wait, watch, and fill gaps. As you can tell already, just from my series of presentations to you, this is just a staggeringly rapidly changing environment that we're in. I mean, I've never seen anything like this where, I've really got to stay on my Twitter feed right up until I do a presentation because there's some new little wrinkle of news that has come out. The stock market's crashed because of this, or somebody released a report about that, or a new outbreak was found over here, et cetera. And people are reacting to it. I don't think any of us have lived with anything that is as rapidly evolving and consequential in terms of news cycles as what we're living through right now. Your coronavirus relief funds must be spent by December 31st of this year. And clearly, rule number one is spend every last penny of it. Don't leave any of that on the table at all. But the second piece is you might almost, you want to have a little bit of flexibility there, because we don't know what's going on with the economy perfectly. We don't know what's going on with the pandemic perfectly. And we don't know what the federal response is going to be to either one of those things in the latter half of this year. And so if, for example, we find out 2 weeks from now that the federal government comes out with another major stimulus bill that has certain features, then you need to take that into account as you think about how you're using your money in the latter half of the year. If, by contrast, they go into austerity mode and say, oh, it's time to balance the budget again, we can't afford anymore, and we think the economy is going to come back on its own, that's a completely different environment in the second half of the year to respond to, and it has different implications for struggle across Washington County and populations. So that's that sort of differential timing, your ability to spend to the end of December, but this whole CARES Act expiring currently at the end of July makes that second half of the year very important. Trying to think about excuse me, I just knocked my headphones off there. How are you going to use those resources? Second big point is, look for opportunities to piggyback on existing administration and where people have already created applications and are already doing the work to get this money out. I do give credit to the federal government for having pushed money out as quickly as they did. And basically, they gave up sort of specificity and detail to get money out very quickly. And that was important, and they were effective in implementing that. I think in the same way as you think about deploying your resources, making it less complicated to get that resource out, and looking to agencies and partner agencies, or even embedded in your own government. How do we leverage things that are already going on? So, as I made reference a while ago, City of Portland turned to 211 Info to push out some rent relief. That would be a candidate for you as well. The Oregon Community Foundation already has an application process and a vetting process for assistance to community-based nonprofits and small business, Main Streets, et cetera. OCF may be a potential partner that you could work with on that. And then I've even thought, and I recommended this to the governor's chief of staff, Nick Blosser, that if we're looking for help to small businesses, then rather than trying to figure out our own ways of going about that, that maybe reaching out to the banks and saying, look, if you've already done all the homework on this PPP, if there's a subset of Washington County, for example, leisure and hospitality businesses that have gotten loans through you and they've had them forgiving and they're looking for a little bit more assistance, et cetera, that using that PPP infrastructure and the banks that are providing that work could be an avenue. Third recommendation is to look for opportunities that could serve more than one purpose. And so, one idea that I've had is using some of these resources for K-12 engagement assistants or monitors or mentors of students. It's all but certain that this upcoming school year is going to look more like what we just went through than it will look like a normal school year. I don't see how we're going to get back to rooms of 25 to 30 students. I don't even think it's physically possible if we're still in a social distancing framework. So there is likely going to be some kind of staggered schedule where maybe kids are coming in every other day in smaller groups, et cetera, and then still relying on online learning. If that is the case, this last spring did not work well at all. I'm not calling out any school districts in Washington County, and particularly, but sort of the national commentary on this is that the schools just weren't prepared, and we shouldn't blame them. This is a hopefully once in a century pandemic. It wasn't in their planning to have something at the tail end of the distribution happen. But very small shares of students were really truly engaged in any way. And if we go through an entire school year with that posture, without any kind of help in trying to help these families and these kids get onto these platforms, we're just going to open up achievement gaps that will last, it will last all these kids' lives, the lost learning that they're experiencing over the course of what could be a year and a half to 2 years. And then your work group already did call this out, but I need to write it down. Apply a racial equity lens to all of these distributions, as I sort of hit on several times in this presentation. This downturn has exposed inequities that were already known to most, but put them in high relief. And communities of color are being hit by the hard part of this downturn in disproportionate ways. Many of them essential workers being exposed, others, in positions that have been eliminated and won't be coming back over the course of the next probably year and a half. So those are my thinking on coronavirus. The other little piece here that I got from 211 Info that I really hadn't thought about, but in terms of the kind of assistance that's needed out there, lots of people calling into 211 Info saying, I'm supposed to go apply for unemployment insurance or food stamps / SNAP online. The library's closed and I don't have Wi-Fi. How do I do that? And it's as I say it, it's like, wow, completely unsurprising. But I had not thought of what a big problem that is. So anything that the county can do or its partner agencies can do to help people through that process of finding that assistance and at least applying for it is going to be important. So I'll end there.
Commissioners, any questions? Commissioner Willie.
Yeah, John, going back to slide number 40, that's the one where you talk about the $600 a week CARES Unemployment Act. And I'm kind of wondering if, do you think that when the federal government was putting together this incentive package of $600 a week and extending it out into July, 16 weeks or whatever it was, 26 weeks, do you think they would have envisioned that they would be providing an incentive for, as you show on your graph there, the bottom three tiers for basically anyone making $40,000 or less, that would be a disincentive to go back to work? Because we've heard of those kinds of situations where these income categories are making considerably more money than they would going to work, so why would they go back?
That's right. And you do have this, among other things, this pandemic has shown how at sometimes uncoordinated our social safety net can be, and how there are sometimes some adverse incentives or unintended incentives potentially built in. Think of the two major programs. The Paycheck Protection Program is a whole, hundreds of billions of dollars designed to keep people at work. And the unemployment insurance program is hundreds of billions of dollars to take people out of work. Right?
Yeah.
And they're almost the same size. And so, and you can go to other countries that are all about the Paycheck Protection Program, approach. And other countries that, but this is the first time we've tried to do both things at the same time, which is terribly confusing to employers and to employees. But to your direct point, it almost has to be the case that, and for very good reasons, that individuals who qualified for this are looking at that and saying, my goodness, this is a huge benefit to me in very uncertain times. And oh, by the way, I've got children at school trying to do online learning and all these kinds of things. Boy, I would like to hold on to this benefit until the end of July and not come back. Please don't ask me back, because I would prefer not to come back at this period, and no one would blame them for that, for the period of time that this is going on. But as Congress thinks about a possible extension, you made reference to a feature that could be helpful, where some amount of money would be sort of paid as a bonus when somebody comes back. Maybe it's not the entire of what they would have got if they had stayed unemployed for the entire period, but they get some kind of bump upon reentry into the workforce.
Yeah.
That could mitigate the problem that some perceive.
Okay, thank you. That's all.
Any other commissioners have questions? Commissioner Rogers, do you have any questions? Commissioner Rogers, are you still there?
I am. I'm sorry. Am I coming off now?
Yes, we can hear you.
Okay, I'm trying to mute it. Thank you, John. Good presentation again. It's always interesting. I'll pick up on Jerry's comment, which is absolutely accurate. What is happening is, instead of giving credits to business for payroll taxes to employ people, they gave it directly. And I have, as you know, that's $600. And we've had through expansion to hire a couple of people, and I can tell you what the common thread out there is. And these are not low wage jobs. They're all saying just exactly what you said. I think I'll take the summer as long as I can get it with my kids. This is a wonderful benefit. I have no interest in returning to work. What businesses are doing, just for your understanding, is we're now spending a lot more on technology and figuring out how not to have to employ maybe as many people. So we're going in the wrong direction. The unintended consequences of the federal government, instead of saying, we'll give it to your employer will continue to pay you. If you don't pay them, we'll take away your credits. They gave it directly, and we've created a lot of unemployment. So now what are we going to do to fix it as people? And I'm not saying you have an answer. Nobody does. It's very complicated. But we're going to have to be in a position where we're going to say, we don't want to be in a country where everybody's unemployed simply because the government puts them in a position to be unemployed. We want people to work for the right reasons. So hopefully we'll all understand that this wasn't just a simple fix. I'll just give people money and somehow mysteriously they're going to come back and do the right things. That's not going to happen. Or the businesses aren't going to react in some way that they're going to figure out how they can work with fewer people. And those of us who are really keen on workforce development are looking and saying, what does that mean? The consequences are severe. So I'm hoping as you start to look at, in your world, at what's happening, that there's some examination of what the unemployment rates are going to continue to do, because you can't keep on having the Chinese buy our debts to the point that they own us, and then that's a bad situation. So we're pretty far in debt. We can't continue to do that. So how do we stimulate people? So anyway, that's just my comments.
Yeah, and just a quick reaction to that. My gut is, and there's been commentary on this, is when Congress passed the CARES Act, they really had in their mindset, and there was much more thinking at that time that this was going to be a quick recovery. That really what we need, we're not trying to do anything that's going to work in the long haul, because this is an extended snowstorm, and this is going to wash over the country, and we'll be back to something close to normal. I mean, Ben Bernanke, former Fed chair, said it exactly. This could be an extended snowstorm. So I think that's what was in their head. They worried a little bit less about that disincentive, because it was going to end in July, and then everybody's going to have their jobs back. They'd all go back to their restaurants and their bars and their hotels and everything else, manufacturing spots. And now we know that's probably not the case. And so the real challenge that Congress has is, number one, sort of working back on that big disincentive that they created if they extend this, so that those who do have jobs to go back for are incented and inspired to go back to them. But then they also have, a sizable number of people who, because of the pandemic, are probably, the economy isn't going to create jobs very quickly for them. I do think we're going to have, we've already got any number of restaurants that are going out of business, and so whoever was employing them doesn't even exist anymore, and so it's then harder to go find a new spot. There is nothing to go back to for numbers of people, and the question will be what kind of assistance is provided going forward for those who truly are genuinely don't have options in the immediate term. That's going to be a challenge. You did make a comment on automation, or workarounds. Okay, I'm going to do something and I'm going to do it without people. There is a history lesson here. One of the highest gains in productivity in U.S. history was during the Great Depression. Yeah. And businesses, they didn't, for any variety of reasons, didn't have the access to labor that they wanted or needed to get their jobs done, and they innovated around it and had very sharp increases during that period in the 1930s and then into World War II of increased output per the people they did employ. And we could be in a period like that again, where people like yourself are just going to say, all right, I can't get this done. Let me figure out how to get it done with the people I do have.
Any other questions, commissioners? Nope. That's it from us.
All right. Well, thank you so much, and best of luck with your budget.
Thank you for helping us have a better understanding of what the future months in calendar year 2020 might hold and into the first 6 months of the second 6 months of our fiscal year. It's certainly unknown territory, and I know we'll learn more in the coming quarters ahead. Thank you
All
very
right.
much.
Stay well.
You too. All right, so the next topic on our work session agenda is a COVID-19 update, and then after that, we will take a break.
Madam Chair?
Yes,
Would
sir.
it be possible to take the break before we have the COVID update?
I'm all for that. Everybody interested? Yes, that'd be excellent. Great. So we will be back here in 15 minutes, so we'll be back at 3 o'clock. Thank you. emphasizing so much that. And so we're back to the topic of our COVID-19 update with our Director of Health and Human Services, Marnie Kyle.
Okay, good afternoon, Chair Harrington and board members. Just for those listening in on the phone, I did provide an update this morning with a PowerPoint. So this afternoon is just a second check-in. I do have some new information that I wanted to share with you. Our public health department is getting signals from the governor and OHA, from the governor's office and OHA, that indicate that we may not be able to move into phase 2 as we had planned. It's my understanding that the governor's office will be contacting Chair Harrington, I believe even possibly trying this afternoon, and also contacting the other metro county chairs, so Chair Bernard and Kafori, to discuss her thoughts and plans. We did just receive the OHA update, and there's 278 new cases statewide. It's a huge number. A big part of that number is Union County with, I think it was 119 cases today from Union County, but I will say that the metro area is contributing to those. Unfortunately, Washington County is showing with 37. That's a 37 new cases. My memory is that's the largest one-day total that we've had since we started this pandemic in February, so that's not good news. So with that news, I think that it's prudent for us to hold back on submitting our application tomorrow as we had planned, and at least until we have the opportunity to have a conversation with the governor's office and with OHA and to get clarity around what they're thinking about phase 2 reopening.
Do we know what the demographics look like on these new cases over the past few days in Washington County?
The 38 that we, or 37 that we just learned about today, no, we probably do not.
The last couple days?
We do know demographics over time, and I can get that information for you, but we all along have been reporting the disproportionate impact to the Latinx population, and that continues to be the trend when you look at race and ethnicity, and it is people that are in essential positions, so people that are working in healthcare, or in health systems, migrant and seasonal farm workers, folks that are in essential positions that can't work from home, can't telecommute.
I did, this past weekend, I was out in Washington County and out and about, and I did go by strawberry fields where there were facilities I hadn't seen before, with bathrooms and a washing station, and there were no big buses, there were smaller vans and individual cars. So it was a different look than what I've seen previously.
Yes.
In the fields.
I think our community-based organizations and our public health staff have done a fabulous job of getting out and working with the farm owners as well as the farm workers and getting better living facilities. They're the same facilities, but better conditions in those facilities. The field hand sanitizing, restrooms, reducing the number of people that are commuting together, and issuing face coverings. I think a lot of our KN95 masks have been distributed to the population. And lots of information. Virginia Garcia, Salud, they are making regular trips out there offering testing, offering information about the infection and prevention. So lots of great work going on with that community.
So I have a couple of items that I want to bring up for board discussion and consideration with regard to COVID-19. As the Metro Tri-County chairs have continued to meet generally 3 days a week, but the last couple of weeks we haven't met on Fridays. We have been trying to look at the numbers to see what might be the effect. You know, Clackamas County opened through phased one at least a week before we did. We reopened under phase one on June 1st, and I remind myself today is the 16th. And then last Friday, Multnomah County was hoping to apply on the 12th, or was it actually enter?
Yes.
And now the two counties proceeding to phase two has been paused for a week, and Multnomah County entering phase one has been paused a week. So in some ways, it sort of accentuates the difference of time. So this concept of, you know, gee, so how are we doing now as an overall region? And I've been pretty clear, look, you know, in Washington County, yes, there are folks who are concerned about what phase we're in, and they've been sharing those concerns with us. For some folks, they're able to have it's a personal decision, how much they're out and about, or many of them, but not all of them, can telework. So I'm wondering about two things. One is if we have an interest in joining our regional colleagues in lobbying in the upcoming state legislature to extend the eviction moratorium. That's a specific detail. What I really would like us to entertain is a discussion of, do we want to continue to apply and go through the phasing on our own as we have, independently of the other two, or also from a public health standpoint, I've not asked yet, are we learning something as a result of that differentiation of timing that we might need or want to consider as we confer, as the CAO confers with us on reopening? Is there anything that we should have, so there's two subparts there. Marnie, is there anything public health-wise that we've learned or not? And then a full board discussion about, you know, how do we navigate this? What if we're possibly in a situation where we're required to only go to the next phase together?
Well, from the public health perspective, what I would say is I think that, as you mentioned, it's been less than 2 weeks. And so that we've moved into phase one. I think that everybody was concerned that as we open up more, that we would find that we would have new cases, we would have more cases, a surge of cases. But we also know that our increase in testing contributes to the number, not necessarily the percentage of positives. The excellent work that public health is doing to do case finding contact tracing, and so the people that we are testing are people that have been exposed and are at risk, and so we're seeing more positives. I don't think we have enough time or information to say, you know, is this because we opened up? Because there's a lot, it's complex. There's a lot of reasons why we're seeing more numbers. Some of it is absolutely because people are out and about more. We don't know the impacts of the demonstrations yet. That's just starting to come, you know, into the, you know, we're just starting to expect and to look at that. So we don't know the outcome of that yet. So I think there's more questions. I'm sorry to say, but I think we probably have more questions than answers. If we did not have to worry about human happiness and economics, we would probably say we should just stay home and stay locked up for a long time until there's a vaccine. But we know that has to be balanced with our human tolerance and need to be around other people. And we know that people are suffering because of the economic impact of this. And so we know that we have to find that right balance. I think, like we've discussed here many, many times, it's both the public health strategies and everything that we're doing to prevent disease and to control the disease, and it's also asking every one of our citizens to continue to help by continuing to do the physical distancing, even when they're out in public, wearing the face masks, hand washing, all those things that we've been talking about.
Mr. Willie?
Yeah, Marnie, when we started talking about moving into phase 1 and increasing our testing at the same time, I thought we were going to convert to a percentage of positive testing versus the numbers. And if we do that, you said that this is the highest number in one reporting period, 37, but it's 13% of what was tested, okay? If you look at the report that come out on the 15th, 15.3% of the overall cases reside in Washington County. So from that standpoint, we're less than what we currently have. Mm-hmm. So I don't want us to get too much lost in the total number of positive cases, even though that is concerning, when we really are doing a much better job in testing. And so we can send mixed messages by the numbers. I certainly know how to do that, but still, we're at 13.3%. We're less than what we have been up to this point in time, and I guess I'm not ready to sound the alarm. The second part is I completely agree with it would be good to know. I think we all have concerns when we see on the TV every night thousands of protesters in downtown Portland, and probably virtually half of them or more do not have masks, and they certainly are not socially distanced. So what's going to be the impact of that, the ripple effect of going back into all the region, not just our 3 counties? And I guess from the standpoint of your question, Chair, about the 3 counties functioning as a unit, if that's what you meant, I'm not sure exactly that's what you meant, but if that's what you meant, I would be opposed to that, quite frankly, even though the virus knows no boundaries, and certainly borders don't have any issues with that. It travels all over, but I'm just resistant to being tied to 2 other counties, quite frankly, that may perform considerably different than we do. So I'm not a fan of the 3 of us being tied together.
First of all, I want to state that our first responsibility is to the public health, and I recognize that. But I also think that, again, the virus knows no borders, and we have to be looking at what our performance as a region is and our performance as a county. But we also have to look at what our county has done in relationship to being well prepared to enter phase 1 and well prepared to move ahead into phase 2. And for example, the fact that we have our contact tracers in place, the fact that you reported this morning that we have, I think it was a perfect score in relationship to our contact tracers. I don't think that can be lost in the discussion of how we look at this as a region. And that may be, in fact, a need to help out other counties as well. But I want to hold on to the fact that I have a high degree of respect for the amount of work that you've done and that the staff has done to place us into a very positive position with this pandemic.
Thanks. And I mean, I certainly, I think somebody was teasing me about this the other day, that I wish I could control these numbers. So you're right. We aren't really looking at the number of new cases, but we are looking at the percent of increase in cases, because that's one of the phase 2 criteria that the governor has set. And that is that we need to be below 5%. And before the number today, which we haven't averaged that, we were just over 11%. And then the number, when we look at the percent positives, we're looking at a rolling 7-day percent. And so we actually have better numbers than what you're seeing even today, just looking at 1 or 2 days. But unfortunately, we're around 1% to 1.7%, and now we're over 3%, which is going in the wrong direction again. So you're right. The number of cases becomes less and less important as we increase our testing. But it's even the complexity of even that percentage could be increasing, because we're case finding. We're public health is doing their job. They're doing the contact tracing, and they're finding people that have been exposed who are more likely to be positive. And we're not spending a lot of time and energy finding people that might be negative. But the number that I haven't been sharing with you, which maybe I can start sharing, is the number of negative tests, because we've had a lot of testing, and most of those are negative tests.
Well, I spent more time on the regional dashboard last night than I think I have previously, and I spent more time with the different tabs. I don't know that I'd really noticed them before. I'd only looked at the main dashboard sheet. And so there is information on the total number of tests, and then those are positive. So we can see the trend over time, if I'm remembering the right chart.
Yeah, on our reopening page, we have daily case count, daily positive test, and it gives the number as well as the rolling 7-day average, the percent of case increases, and then it gives the hospitalization and prevalence. So on that if you just go to the reopening page, the data there provides all of that too.
I was really looking forward to our phase 2 reopening. What I'm wondering about, particularly through science papers that have been posted on the internet, circulated, as well as national news coverage, well, even last night, seeing a pretty gross-looking piece of lung that was damaged by this virus. As much as I want to have our reopening move forward, I also have a concern about the long-term damage that the human body may be enduring, or the long-term serious consequences, right? There's death, and we've got data on deaths, but there's that long-term consequence. And I'm certainly not trying to be a doctor at all. From a public health standpoint, do we know anything yet, or are we still in the total early days of understanding the effect of this virus? Because what I'm trying to figure out is risk, right? I have appreciated that here we are in about the 14th week or so of this experience, and we know so much more than the first 2 weeks of March. And I feel a little less powerless. as a result of that additional information? You know, if I wash my hands frequently, sanitation, wearing of mask, limiting my interactions, physical distancing. Do we have medically, do we have any handle on more on these long-term consequences that could help us in our thinking?
Well, like you, I'm not going to play a doctor either. I'm a nurse, but not a doctor.
But you're closer to public health than I am.
And I haven't, I can't say that I followed all of the research very close, really closely. But what I do know is that it's still early and we are still learning, and we're learning, and, it's even the definition of long-term, because, that we're, if you go back to, taking into account what we're learning from China and other countries, we're still only several months into this. So is long-term, years, or is it chronic 6 months and then people get better? I think that there's a lot of research that's happening that will help us to understand that over time, but we don't know at this point. And I think it's you okay? Okay. I think that we have a lot to learn, and I have heard that over time, that as the big public health system, thinking nationally and worldwide, working with our elected officials at all levels and working with the American public, we are going to have to figure out what can we tolerate. And how, that's that balance of what can we tolerate around morbidity and mortality versus economic impact versus social and psychological impact. And we're all learning that together, and it's hard.
Before I move on to the first of the questions, did commissioners want to make any other comments on the what-if scenario of our having?
I never assumed that we were going to be just totally right into But I wasn't so sure that was actually going to happen.
Yeah.
My apprehension wasn't actually
Yes, you were far more pragmatic than I was.
Yes.
Yeah, I mean, yeah.
Yes.
I think you're right to be pragmatic about this. Commissioner Rogers. Oh, I'm sorry.
Yeah. Oh, are you done,
Yes.
Dick?
Yes,
Okay.
Yeah.
Okay. I didn't want to interrupt you. One comment and then one question of Marnie. The comment is I echo Commissioner Willie's comments. I'm not too interested in being regional on this. I'm regional on a lot of things, but on this particular issue, I think that there's a host of reasons that we ought to all have our own programs. And so I'm much more comfortable telling constituents that we're dealing with this in the best way we can, and our time frame might be different. So I agree with him there. Marnie, my question to you is that what's going to be the public message? I heard what you said, but there are going to be a lot of people who are not going to be very happy. I speak with a bunch of business people tomorrow, and the day after that as well. And they're going to say, here's Washington County doing something again. And they're already unhappy. And I've tried to explain consistently that we're following best health practice. So we need a public health message that says, based upon what we're hearing, our chair is hearing from the governor, or just from the numbers, that we're not going to get approved. So it doesn't make a lot of sense at this point to apply. But can you share with me, and I guess the entire board, what are you going to say other than the soundbite that you did? Are you going to have a press release, or how's it going to work?
So this is late breaking news, less than an hour old. So, I mean, some of it right now is just, as I said, we're receiving these signals. So it was awkward timing meeting with you all right now, because I don't have any of this, I don't have anything verified. I've just been receiving information that it's unlikely that we'll be able to move into phase 2 as we had planned. So first of all, I have to get information verified, and I have to understand what are the requirements. It could be that we just need to meet the requirements that the governor has set all along, which the data that I shared with you this morning, at least 3 of the health prevalence data we're not meeting. So, and that's, that could be the message. So I think we have to just verify and confirm information and then put together our public message.
Is that information available on our website? The information that you displayed for us this morning about
Yes.
those trends?
Yes, it's on the reopening page. There's a data tab and all of the charts and graphs, and you just hover over and you can see all those numbers.
Just one more
and I-
comment.
And I
Oh,
think
I-
our PowerPoint is also available to the public.
Marnie, I was just going to simply say that as you say this, it's probably going to go out in the next few minutes. I don't know how news gets it that fast, but for those of us, and that means all 5 of us, plus I guess your staff, the sooner the better. We really need something released, and I'm not the expert on that by far, but
Yeah.
something very, very soon, because when it hits tomorrow or tonight, we're going to have some common theme. And so please don't make it a priority for Thursday or Friday. Let's do it tomorrow.
Yep.
Thank you.
If not tonight,
So
yep.
I think your idea and your request is spot on, not only with regard to the opportunity to move into phase 2, but hypothetically, if the state requires the 3 metro counties to move into phase 2 together as a unit versus as 3 individual counties, I think the state needs to ensure that we have some good public health-based messaging about why the state has required that of us. So that's a really good idea. Thank you very much. Anything else, commissioners?
Well, you were going to say what I was going to ask about. I've been hearing that we were going to be lashed together, the 3 of us, the 3 urban counties, per the governor's decision. Is that a certainty, or do you?
No,
Well, I think it's a certainty.
no, it's not certainty.
But it may, that's a possibility.
It's a possibility, not certainty.
So I started with 2 questions. So the other question was, the eviction moratorium will be expiring at the state level the end of June. Do we want to join our regional colleagues in lobbying in the upcoming state legislative special session to see that extended? And our interim government relations director is here as well.
Hi, I'm not sure, is this on?
Yes, it's on.
Sorry. So tomorrow at AOC District 8 meeting, we'll actually be having a conversation. We just got some more information from Salem about what will be on the agenda. The eviction moratorium, both for residential and commercial, will be on there. And so we're working up some notes for you all as you speak, and we'll have more information on what that's going to look like. It's late breaking, like the last couple of hours, so.
Okay.
So we'll have more information for you before, hopefully before D8 meeting tomorrow, which I will tell Paige I just made that promise.
And I certainly hope that meeting was posted on our calendar, because that would be a quorum session.
Well, as far as the business side of things, I mean, we're all at least going to grocery stores, most of us. I think we also need to impress on the business people that they need to show their entrepreneurial flair and their imagination and their instincts for survival. And one-way aisles, really insist on face masking. I've been struck by the inconsistency. Some places, businesses, you can't come in unless you have a face mask. Others, people are coming into grocery stores without face masks. There really is no excuse for not wearing a face mask. Everyone should be wearing a face mask. There's just no excuse for it. There needs to be, one entrance in, one exit out. I feel like we're not treating this with the full seriousness that it really warrants. I mean, we all want to open up, we all want to go into phase 2, we all want to see business prosper. Everyone needs to be more serious about all of this, consistently across the board. Some of us are, some of us are not. I think our communication needs to really, there's just no excuse. You need to just be wearing a face mask, period. You owe that to your business colleagues, you owe that to your customers, we owe that to each other. And people need to be serious about how they sort of allow a number of people to come in and out of places of business. I think if we all do that, we can maintain some modicum of economic activity here. I mean, but I feel like we can't just be complaining. We also need to be, all of us need to be strong with our customers to, we really do, we do need to be more serious consistently across the board here.
So I appreciate the call to action to encourage everyone that can to wear a face mask. I just want, just for awareness, that there are some medical conditions that people have, or disabilities or intellectual disabilities that we all understand. I just want to say, since this is recorded, that you and everybody else understand
People
that
going the wrong
they're-
way in these one-way intersections or these
Right.
one-way aisles. I mean,
Right.
Come on, I'm still running into that.
Yes.
Come on, we
Yes.
can all look down
Yeah.
and see where the arrows are pointing us to. Take
But
a
it's-
couple extra steps and walk back on the aisle the right way.
Yeah. It's like vaccination. If you can and you don't have a medical contraindication, then you should, to protect everybody around you, all of our loved ones.
So I guess to your point, Commissioner Schouten, it's the disparity between the different businesses. I'm surprised at how some are very, very strict and others are not. But I do confess I have walked down the wrong aisle. I just want you to know.
You just have to walk backwards then.
Yeah.
Yeah. And there wasn't I think that the difference between businesses is because of most businesses, there wasn't a requirement in the governor's recommendations or OHAs. There's a few where that is not the case, but most, it's not a requirement, it's encouraged. So, yes.
Yes, I'd rather see us be a little more assertive in those areas so that we don't get hung up on these long lags between going to phase 1 to phase 2. Wouldn't it have been better if we had all taken this more seriously and been more consistent across the board, and we could all be going into phase 2 now? Instead, we're in this purgatory. I couldn't imagine, after looking at the last couple of days, that we were going to be going into phase 2. These numbers are just not good.
Yeah.
And our younger population needs to take things more seriously too. Again, this isn't anecdotal stuff, but I'm just seeing too many people in their 20s and 30s just not face masking and not social distancing.
Yeah.
So back on the eviction moratorium, we had a constituent correspondence from Catherine Gallion, who works with Community Action. So this was in our constituent packet of page 9 and 10 of the June 5th, 15th. And the response there was to direct her to engage with Annette Evans. So I asked our CAO if there was any messaging that we should be aware of, given the response on that constituent communication. Mr. Rhodes, I gave you a heads up I was going to ask about this. I assume that's why Annette may be here.
No, she's here for the
the
support of
housing
public
thing.
housing.
Yeah, Annette's been very involved in that, or.
I'll chime in. For those of us who have tenants, which I do, you try to be sensitive, but I'm not certain this is something that we can legislate. There are so many reasons for evictions: non-payment, destroying the property, people who are using illegal substances. So if we want to do this right, and we want to entertain it, I would say that we have some more robust conversations, not only with tenants, but with landlords as well. And I think most people that I know who are landlords, we're trying to be pretty responsible in this period of time and, give as much latitude as we can. But to say zero evictions is probably not where I would be at all. In fact, I wouldn't be there.
Yeah, so we'll be talking more about the idea of the state legislative action and the state action in the District 8 meeting tomorrow. But what I really wanted to make sure, given that we won't have the benefit of all of our staff in that meeting tomorrow, to find out if there's any other messaging beyond what we're already familiar with through the eviction support and the rental assistance that we've all talked about here multiple times over the last few weeks.
Yesterday, we worked on the response to Catherine, and there was involved in that in review would be Annette, and I spoke to Jenny as well as Paige and Julie. And we crafted a response to her inquiry saying that we think it's important, that we were going to be asking and working on another letter. We're going to ask the board to submit another letter to the state. We clarified that it wasn't in Washington County. We didn't have that jurisdiction to enact a moratorium unless the governor or the state gave us that ability to do that. So that's one thing we responded. The other question that I had that I'm hearing is, we're getting more CARES funding for rental assistance. And some of the things that I'm hearing in the community, it's really hard to get into and get somebody on the phone. And what I've discovered is that, yes, it is difficult, but the staff at Community Action is spending 60 to 90 minutes per person to get all the information to make sure that they are eligible for the funding. So one of the things that I talked to Jenny about was perhaps we have a conversation with Catherine about whether or not we could help with some of the assistance in terms of answering phone calls and looking at other organizations that might be able to do that. So that's one thing we're exploring. In addition, we're hopeful that the board will send another letter in support of extending the deadline.
Well, we'll be talking more about that tomorrow.
Okay.
Okay. So I had a couple of detailed questions for you that have come up, just for Marnie. One of the questions I received was thinking that the counties have to sign off on school district plans. My read of the phase guidance doesn't indicate that the county has to review school district plans.
So I think that is under discussion and negotiation. It has been raised, and I think the counties are concerned that we don't necessarily, our public health staff don't necessarily have the capacity, for example, in Washington County to sign off on 130 individual school plans. And so we're under discussion with OHA and the governor's office to look at different ways to accomplish those goals.
We might want to weigh in on that as a board. I mean, there are limits to what we can do without further assistance from the state.
Is that currently a requirement, or is that one they're contemplating?
So there is no current requirement because they're still looking at the guidance to schools, but they did at one point. It was one of the strategies that was being discussed, and the public health leadership in the state pushed back really hard. And I believe that it will likely be taken off the plate, but it certainly wouldn't hurt for at your District 8 meeting or wherever you're discussing, or at this board, if you want to push back, I can get Tricia to get us the latest information.
Well, I haven't seen any draft documents that indicate this, so I wanted to take the opportunity to ask during our COVID-19
Yeah,
update
there
time.
were some draft documents. I just don't know in the last week how much it's helped to have our public health directors say no. So it may have already been taken off the table. I'm not sure exactly.
I know as one member of 5, I'm not interested in our being required to take on another significant responsibility without cost coverage.
Yes. That would be a very consistent message with public health.
So do any other colleagues want to weigh in on that at this time?
My concern is that we are working with OHA to make sure that there is a process for schools to get the support that they need to ensure that they're meeting their plans. But that I agree 100% that we don't do that. That's not within our job description, so to speak.
And I can ask Tricia to provide a short update to the board about where those conversations are.
I think she's been having her ears burning on this topic. Thank you, Tricia, for
Come bail me
listening
out,
to
Tricia.
our work session
bail
and
me
being
out.
available on such short notice.
Yes,
Thank you for being here and
now
all
on
the hard
Zoom,
work
I can
you're
listen
doing.
to you while I'm doing something else. So yes, you were asking about the school endorsements. Yes, public health, local public health is required to review the plan, 3 sections of each plan. And
Sorry, I should have distinguished.
Okay.
There's the plan, but also inspect each and every one of the buildings.
yeah, no.
Okay.
Yeah, so they have a template that they're filling out, and there's 3 sections that we would be expected to review. As Marnie mentioned, it currently reads for each school, which makes us nervous about the amount of work. So we're working to understand that and work with OHA and others in our region to determine could we do something at a district level, and then if there's specific concerns in a district with schools, certain schools and different, each school is slightly different, could we then drill down as needed to support them? We do have a call with the school districts, and it would be all school districts, public and private, and higher education. So we have a call on the 23rd to discuss this with our local school administrators. Is there any other questions?
What are the 3 things that we're required to sign off on? Do you know?
Well, I think it's disease mitigation, it's facilities, what are you doing in your facility? What are you going to do in terms of if you have ill students or staff? So it's different sections. The sections, there's a number of sections that would not apply to our need to review, like their use of electronic education systems. So it's like about a 10-point template that they'll be going through as to how they're doing busing and, electronic learning and all kinds of things like that.
So then my last question is, under normal times, so pre-COVID, could you describe for me the county role with meat packing plants? I don't even know, I don't remember if we have any anymore in Washington County, and food processors.
So yeah, we do not oversee those industries. Department of Agriculture oversees some. For example, in this state, we don't oversee the grocery stores. In Washington State, where I practiced for a while, we did in public health. And then of course, now USDA would be our other group that we work with. And we have worked with them on facilities here in this county throughout the course of this pandemic. We do have concerns that those are some of the
industries that are harder to implement physical distancing, and of course, no telecommuting. So we have worked to help them understand what they could or couldn't do. We've made a request to the governor's office to consider requiring face coverings. They're not requiring face coverings for those industries because they're not public facing, but we've already made a recommendation that we would like to see that as a change going into the future. We have encouraged face coverings, but it's up to each of the businesses to make a decision about what they want to do and choose to do, so we'd rather to make it mandatory.
So ordinarily, if I understood all this correctly, ordinarily, meat packing plants and food processors don't get a Washington County Public Health inspection and license.
Right.
Thank you, I learned more. I really appreciate your entertaining all these different questions. Including Commissioner Rogers, are there any other questions or comments that you want to make on this COVID-19 update? Okay, seeing none, we'll close that work session item and then move on to our remaining work session topic, though Ruth has left the room for the moment. Should we take just a 5-minute break? Or should we start? I've not been in this position before, so. How about if we just take a 5-minute break and reconvene at 3:50? You okay with that, Commissioner Rogers? We'll get going now.
Okay.
So welcome. We're on to planning and implementation of the permanent supportive housing service measure in Washington County.
Good afternoon, Chair Harrington, members of the commission. My name is Ruth Osu. I'm Deputy County Administrator, and I am here with Annette Evans, Program Manager for the Homeless Program, and Comey Calavar, the Director of Housing Services. And we're going to be talking about planning and the implementation of the Metro Supportive Housing Services Program that was approved in May. Next slide, please. The metro area ballot measure authorizes a personal income tax and business profits tax to fund homeless populations and prevention, supportive housing, rent assistance, and other services to stabilize people experiencing homelessness and housing instability. As part of the regional effort led by Metro, Washington County, along with Clackamas and Multnomah counties, will partner with local government jurisdictions, service providers, and other stakeholders to provide supportive housing services to meet the growing population caused in part due to the lack of affordable housing and a growing need for support services needed to successfully house and stabilize individuals and families. And it was great to have that conversation with Echo Northwest just a little while ago, because he touched on many issues that we're facing, not only with this program, but with the Affordable Housing Bond Program. But one of the requirements of the measure is that Washington County submit an approved local implementation plan by the end of the calendar year, and that's the reason we're here today. We don't have all of the answers, but we know we need to get started. We only have 5.5 months to get the plan in place, and there's a significant amount of time that we will need from staff and from our partners within the community to get this done. We don't have all the details, but we want to begin, and as we get those details from Metro through the Summer Stakeholder Committee, we will then incorporate those. Similar to the local implementation strategy for the Affordable Housing Bond Program, the local implementation plan will incorporate strategies to advance racial equity outcomes, engage the communities of color, and historically marginalized communities. And today we begin that discussion to organize our internal team and receive guidance regarding convening a group to advise the county on local implementation plan. And in the audience, we have members of the internal team here from housing services, community development, community engagement, health and human services. And so we're looking at expanding that, but right now, that's our core team. Next slide, please. We're here to seek the direction of the board as we engage the community in the development of the local implementation plan and how best to have the board engaged throughout that process. As you recall, through the local implementation strategy, we came before the board at least 3 times to review that strategy, and we had over 300 or 400 meetings and calls with people in the community. And we want to seek your guidance in the establishment of a local body to develop that plan. And that's different than the Affordable Housing Bond Program, where we weren't required to have a committee. So that's one more step in this process. And so we also want to begin to talk about the long-term impact of the organization, on the county organization, to fully implement this regional supportive housing services plan long-term. This will be over 10 years. And as you heard earlier, the estimates for the amount of money that's going to come into Washington County isn't as much as had been planned because of COVID and other things. But when you consider that right now, Washington County uses about $4 million in combination of their continuum of care, the ESG funding, and some general fund funding, And we're doing our homeless programs with about a little over $4 million a year. And you think about 60 million coming in annually. And so with the current staff and organization we have, we need to think about how are we going to do that. Next slide, please. I won't spend a lot of time on this slide. This is something that was shared with the board last week. I just wanted to remind folks that we have 5.5 months to do a lot of the work of research and to identify and convene the stakeholders, the partners, the community members that need to be involved in the planning process. And as Metro quickly rolls out what we need to stay up with whatever their unfolding plans are. And so, for example, last week, the board had a discussion regarding the Metro Stakeholder Group, which is the group that will be convened over the summer by Metro. And we did that very quickly, and thank you to Elizabeth who came to you, and your input was received by Metro, and those appointments are being made. Next slide. So from July through April, the county has about 10 months to get ready for the implementation of the Regional Supportive Housing Services Measure. And in the same 10 months, the staff that you're looking at is working on the current issues of COVID, CARES, homelessness caused by the epidemic, protecting the homeless from the illness, the implementation of other ongoing programs, and we need to have this done also. Next slide, please. So this is Metro's implementation advisory structure. It gets complicated, but if I could just focus in on the implementation plan and the partners table, which is at the bottom to your left. Already we have staff working with Metro on that. They're advising the stakeholder advisory table, which you named a few Washington County representatives. And also there'll be a subcommittee that will be discussing the equity outcomes. And then, of course, it goes to Metro. And when you'll see below, you've got the tax implementation advisory table, which I know, Commissioner Willie, you've already said you're interested in that. And then we have the Metro Council looking at the implementation plans at the top right. And then the long term is looking at the Oversight Committee and then a Tri-County advisory body. And we're going to be very much involved in all of that in some way or another. It's all to be determined yet, but we know that we would like to talk to the board about making recommendations to the Oversight Committee when they get to that point, when Metro gets to that point. And also, we'll have to have a discussion about the long-term Tri-County advisory body that sets the metrics and looks at some of the outcomes over the 10-year period. And within the ordinance that was passed by Metro, the county will be required to participate financially in convening that group. Next slide. I'm not going to spend a lot of time on this because I think we talked a little bit about this in the ECHO Northwest presentation, but as we heard, there's currently an estimate of receiving $60 million. And so really when I talk to Metro, they're not comfortable right now talking about that specific dollar amount that Washington County will receive. They're more interested in looking at the current ordinance that says that Washington County will receive 33.33% of the total received after expenses are paid. And so right now, that number is a lot less than it was anticipated when we began this discussion in January. Nevertheless, we're going to get a lot of money, and we have to be prepared to put that money out quickly. Right now, our strategy through the continuum of care is we pass that money through. We need to talk about whether or not that's the right strategy for this new measure, or do we need to set up some other kind of organization? And we're going to be coming back to you in a few weeks to talk about that based on a study that was done to look at the current system of delivery. So due to time and staffing constraints, staff is recommending that we leverage existing organizational structures just in the interim to get us through this next 5.5 months. And we're looking at, with the current staff and the addition of some contractors to help us write the plan, and also looking at the current board appointment committees to complete the LIP for that local committee that we need. And we're going to talk a little bit more about that in just a minute. Next slide, please.
Can I ask
Yes.
a question on so there was a lot of discussion going into this before the initiative was passed about when was the real money going to come through. You're saying here the revenue from the personal income tax will be realized in April of 21, but then you say that the revenue will not occur for at least 3 years. So what's that gap?
Okay, so in the first year, the tax is just coming in, and so Metro's working through the collection. And so what that means is that the full collection of the tax will not be realized until the third year. So we'll be getting revenue, but we don't know right now if that will be the full collection. We don't think so, because there'll be people that'll be missed, there'll be things that'll be changing, and so Metro is more comfortable at this point saying the full realization of whatever Washington County is going to get from that tax will occur in year 3.
So does that,
It's sort of like a ramping up.
yeah, I get the ramping up thing, and I got to go back and look at to see the revenue taxation of it, because I didn't think that was phased in. I thought it was just going to be implemented in the 2020 tax returns filed in 21. But so in that 3-year process, so here we are hustling to get our LISs done. But then the money's not showing up for 3 years?
No, the money will be showing up. The money will be showing up. It may not be it may not fully be showing up, meaning that there are a lot of things that are going to be happening to implement a new tax. And so the full collection may not be realized in year 1 and 2 based on whether or not everyone who is supposed to be paying pays, if they're collecting it in the correct way, all of those things. So what Metro is telling us is that in the third year, they expect to have full collection. And in the first 2 years, there'll be money coming in, but they're just not telling us that it's going to be the full collection. It may be a little less based on some things that will be happening.
Well, I guess I just hope then that the first year or so doesn't all go to administrative overhead.
Oh, no. There will be plenty of money for services. And in fact, we haven't really been told what the administrative services will be. We're guessing 5%, but...
I think that was the number that
yeah.
was discussed in the negotiations, yeah.
Excuse me, my understanding was that there was going to be a front load on administrative costs because of the cost to collect the taxes. So I think that part of that ramp up is the loading of the administrative costs to collect the taxes.
If I might add, I think the other reason for ramping up, excuse me, if I remember correctly, is that they're going to see how it comes in and work out how it's going to be allocated and administered. So if I remember right, that's why the first year I think is divided just 30% or 33, to allow them time to figure out, first off, how much they anticipate to receive and how to allocate it out. So they're alerting us that it won't be until year 3 that they're under the full formula of allocation.
Right. Because I think part of the negotiation was whatever Washington County receives goes to Washington County. And I think that that's also part of it, is how much each of the 3 counties is collecting and receiving.
Right, and that's why they said it would take them 3 years to get the formulas all adjusted.
Is that helpful? Sorry I wasn't more clear.
Complicated, we have a lot to learn.
Okay. Okay. So looking at the county implementation structure, in the future, we'd like to have a discussion with the board about a new structure, or maybe I want to say a modified structure to operationalize this new program. Because when you go from 4 million to 50, 60 million, that's a huge leap. We also want to have a discussion with the board regarding the need for more resources. So what does that mean in terms of how you administer $60 million? Can we do it with the existing staff like we have with the Affordable Housing Bond Program? Or is that going to require more staffing? And it also depends on whether or not we're going to continue in the same way that we are today, in that we are really passing through all of those dollars. And then lastly, looking to the board regarding the county organization and the ongoing community stakeholder structure to fully implement the regional supportive program over the next 10 years. And bringing in new partners like our SHIF, which is the Regional Supportive Housing Impact Organization, which addresses homelessness. And they're organizing and looking at this, but we need to figure out how everything fits in, as an example. Okay.
Can I ask a question on this? So two questions on this particular slide. Consider a new structure to operationalize this new program to address gaps. Are we going to be, is this going to be a one-size-fits-all for all 3 counties, or are we going to have some flexibility to deal with our homeless community that's different from Multnomah County's homeless community?
Well, that is a board decision, but my hope is that we will be Washington County-centric, and that we will do something that works best for Washington County.
Okay, that would be my hope as well. And then the second thing is, aren't we also limited to that 5% administrative overhead?
At this point, I don't have a lot of direction on that, but right now that is what we're hearing is 5%.
So we could put together a new structure group for, let's just say, 5% of 60 million is $3 million. So we could probably fall within that confines and get that taken.
Unless they put a cap on that. And that I don't know.
We're realizing we're not going to get to 60 for 3 years. So yeah, you're right. We'd have to phase that in.
Okay.
Okay.
But my hope is that whatever we get, we will be able to have the self-sustaining with the tax. Next slide. And I'm going to hand this over to our expert in the continuum of care, Annette, so she can walk through our idea of putting together a group to help us through this planning process. And we may want to call it ad hoc or task force, I'm not sure. But I will turn it over to Annette.
Thank you, Ruth. Thank you, Chair and Commissioners. What you see here in this chart is currently our continuum of care structure. And given what Ruth has presented in our timeline to get a local implementation plan developed and do the community engagement, the discussion is to look at utilizing and leveraging what currently exists within our community. I just want to briefly state that on the right-hand side is our continuum of care membership, or what we call the housing Housing and Supportive Services Network, which is compliant with Federal Rule 578.5, which requires that any jurisdiction receiving federal McKinney-Vento funds must have an established governance structure of a continuum of care comprised of representatives from relevant organizations within the geographic region. To the left is the COC board, and that board must be established to act on behalf of the continuum in accordance with Federal Rule 578.7. Those members are appointed out of the membership of the continuum of care. We meet monthly, and on June 3rd, we met and had 62 attendees. So it's a very vibrant and very engaged and involved group. To the left is the Homeless Plan Advisory Committee in the yellow. This is the board appointed by you all to provide oversight to our continuum of care planning and implementation work. And I would like to recognize Commissioner Dick Scouten, who is our committee member and represents the county at that table. The continuum of care structure supports the federal requirements for over $4 million annually to Washington County for the continuum of care program dollars that the Housing Services Department administers, as well as the Emergency Solution Grant funds administered by the Office of Community Development. This structure supports the planning and implementation of a road home, which is the county's homeless plan, and the county's consolidated plan managed by the Office of Community Development. These plans are used as foundational documents for policy development and prioritization of the funds that we receive. In 2019, the Continuum of Care members approved a recommendation to the Department of Housing and Services and Office of Community Development to align our two separate planning processes into one process. This will create efficiencies for participating members of our community and also support a more comprehensive plan process for both our departments. And this planning process will begin in about 2 to 3 years. We'll begin the next cycle of planning, and that will be our focus to align. Next slide, please. So provided today at your table is a proposed list of members for consideration in developing the local implementation plan committee. Metro's guidance identifies the local implementation plan must be developed using locally convened and comprehensive engagement processes that prioritize the voice of people with lived experience and communities of color. The list of members for your consideration represent the demographics of the homeless population. In addition, they are actively engaged in serving the homeless population with housing and services in our community and have helped to develop the county's plans, the homeless plan, as well as the consolidated plan. Names on this proposed list will leverage the expertise of the members of both the Homeless Plan Advisory Committee, the Continuum Board, and other members of our community that have been brought in to support this effort. These positions meet the Metro's requirement to include individuals of lived experience of homelessness, communities of color, culturally specific service providers, county and city participating in the Regional Affordable Housing Bond. Next slide, please. As well as business, faith, and philanthropy sector, agencies implementing homeless and housing services, health and behavioral health, as well as geographic diversity. I recognize that you just received the list today, so it is for your consideration, and as we go forward through this process of developing our local implementation plan committee. It is for your consideration, given many of these individuals represent communities of color. The committee would be about 40% communities of color representation as listed today, as well as just their sheer strength and expertise in addressing the socioeconomic challenges that homeless individuals experience. And with that, next slide.
Yeah, you've got 8 members represented here on the board. How big is that board?
On the proposed local implementation plan? That one, yes.
Yeah, this is quite a commitment from this board. So.
Yeah, it's 20 members.
Okay, so 8 of them, 8 of the 20, including the executive director. Okay. I'd like at some point in time you to weigh in on this, Dick, since you represent that.
So if I could just clarify it, those members are from the Homeless Plan Advisory Committee, the Continuum of Care Board, so different boards, as well as members of the community.
It says COC Board. Continuum of Care Board, yeah.
So
Not Communities of Color. Community, the Continuum of Care Board is
if we
COC.
could go back to the matrix, the org chart, I don't know if we could go back to that. Yeah.
I'm sorry, I'm just.
No, it's a great question, and it's the structure that we currently operate in.
We talked to the Continuum of Care Board and told them that what we were going to do was going to propose to the board that we select members of the HPAC, the Continuum of Care, and HISN to make up the committee. So what you have in front of you is our suggested list. You can change it, you can modify it any way you want. It's just that we thought that using the existing structure that we have here and the people in it, they have a really good grasp of some of the issues that we're going to be talking about. And they also understand that we have to work very hard in 5.5 months to get this done. And so we're looking at, possibly, we told them meeting 5 to 10 times during this period of time.
So I've been assuming you want us to hold our questions and input until the end, or for this committee structure, do you want all of that now?
Please, ask, yes. We would like that now.
Questions now.
Oh, okay. So I have some other comments, but I'll just go over this structure right now. I see very clearly the continuum of care members, some HPAC overlap, great service providers, but as far as jurisdictional, I see City of Beaverton and City of Hillsborough in a couple of places. And what we've learned through or were reminded through the COVID-19 homeless concern is that our governmental partners, our cities in Central and South County, want to make sure that they have presence in some way. And so that's my concern here. I heard you say that you think there's geographic representation here, but the fact that it's done through service providers, I think we've tried that and still got a very clear message of their needs. And so that's my comment, and I'm wondering what your thoughts may be. Because at the same time, I don't want the committee to be further expanded in a way that makes it totally unwieldy for the group to be effective over the course of 4 to 5 meetings.
Thank you, Chair. I too had felt that specifically Tigard, which is, the population's moving towards where they'll begin to get their ESG funds because they've reached or will be reaching the 50,000 population. I do know that there is a few, as you mentioned, service providers who work in the Tigard, South County area. And so I felt like, in a way, that was to kind of provide that representation, but I feel like we could open a specific city position because we don't really call out one for specifically by city. We kind of really call out affordable housing, which led to the county, Hillsborough and Beaverton, because they're on the Metro Affordable Housing Bond. And so I would be open to adding a position for a city.
Yeah, I think perhaps that one solution would be to have an other cities position under that category of number 4. And between Tigard, Tualatin, Sherwood, King City, Durham, let them decide who can make that commitment.
Thank you.
And I'll hold my other comments till later. Any other commissioner thoughts on the committee, Commissioner Willie?
Yeah, well, just to follow up on what you just said, I don't disagree certainly with making sure we have geographic representation, but at the same time, I know that at least when I look back on the LIS that we just did with affordable housing and that entire process, I know that Chris Hardy with the City of Hillsborough and certainly Comey was very active in that process, so they bring some expertise with them along this line. So I just want to make sure that we don't substitute out some expertise in doing this stuff with someone who doesn't.
Thank you.
Any other commissioner thoughts? Commissioner Treese?
I just have a question on number 5, representatives from the business, faith, and philanthropic sectors. Does that mean that this one person represents all of those sectors?
No, I believe that in the requirements that we were looking for someone to either represent business or faith or philanthropic.
And the reason I bring that up is that our faith community has played a large role in homeless support in our community, and it just seems like that might be a hole there.
Okay.
I would suggest for that we add another position there, just like in number 4, adding a 4th position from 3rd, have 2 positions.
I think so. I wouldn't want to lose the business perspective.
Yeah, you've
but
got the HPAC person on there now, but I think your point is taken on the faith community.
Great. Thank you.
Yeah, the one thing I would say, just repeating what's already been said, I think this is a good group.
Great. Thank you.
So are we, Commissioner Rogers, did you have any comments on the local implementation plan committee proposal and representatives?
Not at this point, thank you.
Okay, so we'll move on.
Right. We're finished with our presentation, so are these questions for us now?
Sorry, I didn't realize that was it. I know I have some questions, but go ahead first.
I'm sorry. As you stated, Ruth, I have expressed an interest in joining the tax limitation advisory table. I reached out to Andy yesterday. I don't even know what day it is. And so, but I haven't got a response back. Is that something I should pursue, or should I ask you to do that?
My preference and my comfort level would be if the board would discuss it and decide who would
Could we go back to
represent the
the
board.
slide that has all the different committees on it? And is that diagram anywhere in the material?
I don't think so. Let me see.
Okay. Will this presentation, well, this presentation should be available to us after the meeting.
Yes.
Yeah, that's a very busy slide.
Yes.
Who gets to suggest positions and who does the appointment? I'm sorry, I didn't say that in the microphone.
No,
It's not clear to me.
it's a good point that you're making, and that's the reason why we wanted to show this structure to you, because one of the things that we want to make sure that we have representation from Washington County on several of these different tables, and we really don't know how these tables are going to be formed. So for example, with the stakeholder advisory table that will be meeting over the summer, the board had input last week as to who would represent Washington County. So what I would say, Chair, is that really bringing this to you to let you know that these are the tables that we're going to be watching to make sure that there is representation from Washington County and bring that to you as they are formed. And we're hopeful that the board will be able to suggest names, but ultimately, Metro will decide who sits on these tables and in these committees.
So my understanding is that the stakeholder advisory table is the table that we talked about last week. And there's a business representative, and it is a regional table, but there's 20 to 25 people, and it will only meet like 3 to 4 times
Right.
throughout the summer. And is that the table that Commissioner Willie asked to be on?
No.
No.
Okay.
He's asking about the tax implementation advisory table that's underneath the COO.
Got it. Thank you.
So,
And just to remind you, the 4 people that you suggested sit on the stakeholder table were Roe Taylor, Catherine Gallion, Rich Roll, is that how you say his name? And Bridget Kelfie.
Oh, that was the ones where you individually came around to us and asked, okay, good. Tell me those 4 names again, I'm sorry.
Roe Taylor, Executive Director of Domestic Violence Resource Center, Catherine Gallion, Director of Community Action, Rich Roll, Clinician for LifeWorks Northwest, and Bridget Calfee, Executive Director of Home Plate Youth. And Elizabeth, can you help us out here?
Yeah, then there was also a business individual on that list. And I'm sorry, I don't have that name in front of me, but I can send it out. It was a recommendation made by the WEA.
That was Brantley Detmer.
Someone from Kaiser.
From Kaiser.
Yeah. So I hope I can add a little bit of insight. I don't know if it's very helpful or not. There are 2 blue squares on that chart. This was provided to us by Metro. Everything to the left of the first blue square is a temporary committee to help provide recommendations to the chief operating officer, including the tax implementation box, which is below it. So those are short-term committees that will work between now and I think September to provide input to solve questions that hadn't been solved prior to referral. While there will be some board direction and opportunity like there was this last week, in the end, these are Metro committees that are trying to move quickly to get to September. On the right side of the chart will be those longer-term committees that will provide long-term oversight for Metro Council in the implementation of this. So I know that is not super helpful, but that's some information I hope helps. And also, the committee I think that the board should focus on, and this is really tiny, is the oversight committee. So that will be the long-term committee that will be approving of the LISs, that will be working through any of the policy issues, et cetera. So that oversight committee. And the only other thing I wanted to say was, during negotiations, I was working with Annette, Alex, Ruth, some other folks. We negotiated pretty hard so that we could use, if we chose, organizations that were already in place in Washington County with our own experts. And I think that's where the COC and the Housing Committee came from, was that we wanted to be able to choose folks that we knew already were engaged with our housing efforts. Thank you.
okay. I have some questions and comments, but I don't want to get in anybody else's way first.
I just very localized or very specific. I've always been very impressed with Ellen Johnson. She has pretty deep roots in legal services here in Washington County and has been a long time involved and commented and has reviewed a lot of plans, either with respect to CDBG and housing and all that. So I'm happy to see her on this list of folks for the LIP, by the way. And she is not shy about asking hard questions.
No, and she really has contributed tremendously to the Continuum of Care Board. Yes. Yes. Thank you.
Any other commissioners?
You bring that legal expertise that I think is all part of the range.
Commissioner Rogers, do you have any questions or comments?
Not at this point. No, I'm just listening.
Okay, so I'll go over mine, seeing no other commissioner comments. I've been really impressed with the team here at Washington County, as well as the network of partners. You've been doing a lot with the availability of funding to date. As noted, and the presentation, and Ruth underscored it, the amount of funding will be increasing dramatically thanks to the voters. This is the kind of problem we wanted to have because the societal problem, our community problem, is so large. We told the public that we know what needs to be done. We've been doing some of it, but it hasn't been sufficient to meet the need. So we have a real gift before us now. What my particular interest is with the local implementation plan. I'm particularly interested in how we define the desired outcomes that we're looking for as a result of having this program. And also what targets we define. Now, mind you, this is a long-term program. You've been practicing different things and addressing, a road home, and you've really been focusing on chronic homelessness and solving that for the last couple of years. But you've done a good job of making sure I know that there is a full spectrum of homelessness. So with our local implementation plan, I'm going to need the reminder, that snapshot of, okay, here we are in 2020, and here's an illustration of that continuum of need, the continuum of care, what we've been doing, and out of that, what aspects are we needing to scale up, and where are there aspects that we've not been able to address to date. And so also through this program, we're going to activate. I don't know that those words are right, but for me, for now, it helps me differentiate between those two. And having the local implementation plan lay that out for at least a 5-year time frame will help set not only my expectation as a member of the board, but also our public's expectation. And I'm assuming will help with the future oversight committee, sorry, I need binoculars, for how we monitor over time and how we, as a board, make our investment decisions, whether it's specific to this funding source or our need to seek other funding, leverage other funding, and potentially bring general fund dollars, our discretionary dollars, to bear. There may be pros and cons with the existing structure. I need the reminder of those pros and cons. The existing structure, our current decision-making model, and how with scaling up and activating, we might experience some other pros and cons. Nothing's going to be perfect, but I am confident that through the local implementation plan and the expertise that the current practitioners and you experts, and those on Zoom that I can't see with my own eyes at the moment, I know it will be a good product and a good product approach to last for some period of time, 3 to 5 years. You'll help me better understand what is a better time frame to have. Ruth, I was really glad that you articulated, I wrote down my concern about doing this at the same time as the team is taxed with the COVID-19 challenges that change from week to week. We've scaled up efforts with additional CRF funding. I was really pleased you mentioned that. I will play the devil's advocate a little bit if I can. Well, I can, but it may not be correct. I know we have real housing experts, but I know we've also learned a lot as a state about healthcare and how there are these different, oh dear, Kristen, the phrase dropped right out of my head. Determinants of health. Thank you, Marnie, for saving me. Social determinants of health. And I want to make sure we bring that in here too, though I don't know what it is I'm asking for yet. On community engagement, I want to make sure we have a community engagement team, and you've made it clear through your write-up that you're going to need their expertise. We have to be a little bit careful, though, because it's really a central services model. So as we go through this and into the future, through the implementation and the monitoring, we're going to need to make sure that there's the funding to support however we're asking them to scale for all of this. We can't just assume that, oh yeah, community engagement team, they'll be able to do that automatically because they've got other stuff that they're doing. So we've got to balance that out. So I'm very hopeful. I heard you say that there are, on their implementation structure slide 8, there are 3 additional discussions you want us to have around the structures of the committees, the need for resources, and community stakeholder structure. So I'm most focused on the right-hand half of that picture. But I realize there's a boatload of work to do on the left hand, and I'm here to support you, and I know we as a board are here as well. I want to make sure on the Equity Outcomes Subcommittee that our community-based partners for our BIPOC community members here in Washington County see themselves in this subcommittee. That's the outcome that I'm looking for. You know, one way, sorry, I can't really read it very well. One way that could be achieved is having some of them involved there, but it could also be achieved in other ways. So I'm not fixed on some set solution, but rather on the outcome. So those were all the thoughts that I had at this time. I haven't given you a moment to respond to any of that. At a minimum, I wanted to make sure I gave you the benefit of my thoughts. I don't need an answer right now, but those are my first thoughts based on all of this. That, and I need to get this diagram.
I'll get you a copy of the diagram.
Yeah, no worries. Any other commissioner thoughts? So it looks like we'll have to lay out in the rolling calendar how this will be coming and working out.
Right.
Are there any other, so other than programming that out, are there any other participatory needs that you have of us as a full board or as individual board members? You know where to find us, that's for sure.
Right. I wanted you to be aware of this so that if we quickly have to say, we'd like to put in some names for this committee or that committee, you at least have an understanding of the structure, because things are moving very quickly. And then in the next couple of weeks, you will be hearing from our consultants who were convened by Vision Action Network and Washington County Thrives. It's a report on improving the permanent supportive housing service delivery in Washington County. This was done with the eye toward we're going to have to do something, and it was even before the idea of the measure. So already we were thinking about how best to tackle the problem in conjunction with the Affordable Housing Bond Program. So in the next few weeks, you'll be hearing that, and then after that, we will then be working internally to look at what works best for Washington County, and we'll come back to you. But in the meantime, we'll get the plan set up, we'll get the planning committee set up, we'll start that process, and I'll be working closely with Metro.
I do want to allow for us to have the education opportunity with you where I know you all really focus on Washington County, but you do stay in touch with your peers, whether we're talking about housing, homelessness, behavioral health, public health. You do that work. And what I am going to rely upon you're helping me with, and this can be done one-on-one, is how do I appreciate what the needs of either the definitional model of the homeless community in Washington County is, and it may be in a road home and your biannual or annual
reports.
plans. It's amazing I could remember any of that given COVID times. And how that might compare or contrast with Multnomah County and Clackamas County, right? I know with Clackamas County with this program, Clackamas County has more small cities that are surrounded by rural area. You know, Sandy, Malala, Canby, for example. So their situation's a little bit different than ours, where most of our urban population lives within the metro area where this takes effect. So I don't know where there might be some commonality of problem set, but different approaches as opposed to different approaches because there are differences in the homeless population. And I want to make sure that I feel sufficiently informed and versed in that prior to having to hear from it or about it or criticism thereof from the future oversight committee, because they're going to see the plans from all three counties. So how can we make sure that we have a similar global map, perhaps? Mm-hmm. Commissioner Treese.
I just in thinking about this whole system, I have one other question about the membership roster, and it is directed at number 10. What I've heard over the years is that the police officers, the deputies, and I'm thinking primarily of for example, in Beaverton, the officers that are on bicycles, they have such a constant interaction with the homeless communities that they know them and that they interact and provide support in some cases. And I'm wondering if it's actually the feet on the ground type of person that would be more effective in this role than it is the community corrections or the jail. So I'm just raising that question.
No, that's a great point. I can share with you that we submitted on behalf of Washington County a competitive grant application for a reentry housing program and HUD awarded those funds. And so we are in the process right now. We convened the jail as well as community corrections. Luke Dorff, who's going to be actually implementing the program and working alongside. We want to leverage a lot of the work for the homeless population that is residing in the jail, that under non-COVID times, they are attending the Rentwell courses and working on how to address housing barriers before they exit. The problem is they exit the jail and they don't have resources. And so that is a really strong point that Community Corrections and the Sheriff's Office has brought about, as well as their HOPE deputy that's been out doing this outreach for the last few years. And we've partnered with Clean Water Services with that whole effort with the HOPE deputy and our social work. So that is partly why we went to Commander McCrea, because the jail has seen an increasing number of homeless, and they're trying to address this as well. And he is a member of the Homeless Plan Advisory Committee and has focused on what we're doing through that work, through the strategies and the plan. But definitely open to considering bringing in a city law enforcement.
Well, I do know that in the case, I can't speak to the city of Hillsborough, but I do know in the case of city of Beaverton that Javier Mina, I don't know if I've pronounced Javier's last name correctly, that he interacts with the Beaverton City Police Force quite regularly in addressing and staying on top of the needs of the homeless in their community. So we might be able to ask them to, both Hillsborough and Beaverton, to touch bases and try and help bring that, the learnings and elements and status of that in as well.
I was just impressed by the level of contact, and these days when you say that, you may interpret that I'm saying that like negative contact. That's not what I'm saying at all. It's more the support, trying to get people what they need, trying to get them into the most safe situation that they can be in, and that type of interaction. That's why I brought it up.
Yeah, no, that was great. Thank you.
Actually, I think it's a great idea. Part of the community engagement process is in the Affordable Housing Bond Program is that we brought together different kinds of groups. And you just sparked an idea of bringing public safety from various communities together who deal with this issue and have their input into our plan, how we help address that for them, because you know, there's the national conversation going right now between public safety and social services, and definitely this is part of that conversation. So I think you've come up with a great idea.
Quick question on the sheet. So this is for our locally convened group to develop the local implementation plan. On the back side, the double star represented on the Metro Stakeholder Advisory Table?
Yes.
Okay, great. Thank you. Making sure I get the structure right. Are there any other commissioner questions or comments at this time? Commissioner Rogers?
Sorry, I was unmuting it. No, it's very interesting. My first time through, so I appreciating hearing all this. But I don't have any questions.
Okay. Around the room, around the table? Everybody's good?
Yep.
Thumbs up.
Okay, thank you for your time. I know it's been a long day for you. I appreciate that.
We learned
Thank
a
you.
lot. Thank you.
Thank you.
Thank you for engaging on this. Really appreciate it. And that's it for the number of items here on the agenda. I want to thank all four of you, Ruth, Kristen Burke, Comey Calavar, Annette Evans, for taking us through all this information, Marnie Kyle as well, and connecting all the dots so that we have a community that has stable housing and good health outcomes all at the same time, physical and behavioral.
Thank you.
Thank you.
Okay, that's it. Oops, no.
I just have a question. Mr. Rhodes, you distributed this sheet, and I know we got it in our email. Are we going to be discussing this? Is it just for our knowledge base to have it?
It's just for your knowledge base.
Okay, great. Thank you.
Okay, anything else, commissioners? Okay, seeing none, we're adjourned today's work session. Thank you for joining us, Commissioner Rogers, through Zoom. Appreciate it.
All right, thanks, Jerry. Appreciate that.
Live Oaks board meeting yet? Oh, yeah.
Might actually die.
Oh, thank you.
My first response when he raised his hand, I just responded, no. And that was followed by 5 emails throughout the day. Hey, Stephen, we're done. You know,